Good morning, all. I'd like to call the Education and Health Committee to order. I know that we have members that, a couple of our members have got to have proxies because there's some things happening this morning. A couple of little housekeeping items. First, there is, clerk will call the roll so we can get into voting. So clerk will call the roll. Clerk will close the roll. All right. So there is a bill, and I'm going to have to just apologize to those who have traveled. It is Senate Bill 160. It's Senator Edwards' bill related to those that are hard of hearing. There is a requirement in our rules, and it is a good requirement that we have interpreters for those type of bills, and we are very supportive of the rule that requires that. The clerk's office informed me last night that the interpreter was not available, and I'm simply not willing to move forward with a bill that relates to hard of hearing without that. So therefore, we took it off the agenda yesterday. That's right. That's right. It requires and there's a certain term for it for a type of interpreter. And perfect. That's great. And so anyway, we are not going to hear that bill. And without objection, Senate Bill 160, with concurrence of the patron, Senator Edwards, will go by for the day. Next up, we do have one of the abortion bills that are left. We're going to have that heard in a little bit. It's going to have a fairly short clock. There's a fairly good agreement on that. The school calendar bills, guys, we've all heard them many, many times. Very long day today. It's also going to have a relatively short clock today. And we do have Medicaid bills, which we are anticipating taking up at 9:30. I talked to Secretary Dan Carey late last night and agreed that he would be able to make comments separate from any clocks we put on, but we're planning on putting on about a 20-minute clock, longer than our 3, 5, 7 minutes, but it'll be a 20-minute clock on that. And Dan Carey will be able to speak outside of that clock. With that, Senator Saslaw has got his Higher Education Subcommittee, and then he's got to go to another meeting. And so, Senator Saslaw, I'm going to turn it over to you for those bills.
Thank you, Mr. Chairman. We heard quite a few bills in our subcommittee, and I'll just take them numerically.
Yes, sir.
Senator Spruill had a bill that dealt with mortuary science, and it required every public institution that offered it to require the students to complete practical areas first during their first year instead of waiting to take these embalming courses in the second year. And the reason was that, they'll know right up front rather than have to spend a whole year whether this is cut out for them or not, essentially.
Yes, sir.
And we recommended it. There was an amendment.
Clerk will report the amendment.
Thank you, Mr. Chairman. Senator Saslaw, on line 17, after embalming, strike the remainder of that line through of on line 18 and insert prior to graduation from.
I'll move the amendment.
All right, there's a motion and a second that the amendment to Senate Bill 143 be adopted. All those in favor will say aye. Opposed, no, and it's adopted.
All right, Senator DeStaff.
Let's make a motion on the bill as amended.
Sorry, excuse me. I move that the bill as amended be reported. 143.
Motion is second that Senate Bill 143 as amended be reported. All those in favor will record their votes aye. Those opposed, no. Clerk will close the roll.
Yeas 15, nays 0.
15-0, the bill passed. Senator.
Okay, Mr. Chairman, Senate Bill 373, and there were quite a few bills similar to that. Senator DeStaff had 1, 2, 3, 4. He had 5, and Senator Sturtevant had 1. And essentially, they confined any increase in the in-state tuition could not exceed the cost of living. So, CPI index. So anyway, what we did was we recommended that they be carried over and request that the chair appoint people on the committee to study the issue.
Okay. So the motion is from Senator Saslaw that we roll in Senate Bill 577, 749, 836 together. Does that need to be a separate vote? All right. It's 377 as well, pardon. So 377, 577, 749, and 836. All those in
And
favor?
373.
Into 373, right. All those in favor of rolling those bills together will record their vote aye. Just say aye.
Aye.
Opposed, no, and those bills are rolled together. There's a motion on those bills rolled together. Move
Right.
that they continue to.
And did you include 836 in that?
We did.
Okay, now I would move that they be carried over for the year with a request that the chair appoint a group to study the issue of limiting tuition increases to the consumer price index.
Okay, there's a motion second the bill be carried over. All those in favor?
Mr. Chairman?
Yes, strike the board. Senator Cosgrove.
Thank you. And I appreciate Senator DeSteff and his passion on this. This was actually studied last year, and it felt it wasn't quite ready yet for prime time. Some universities actually have done a really good job in keeping the tuitions lower, some not so much. But, Mr. Chairman, I agree with the motion to carry it over and study it, but this has to come forward next year for some type of action.
Right. I think, Senator, thank you for the comments. You know, we have great institution of higher education. Senator Saslaw has worked on this subcommittee, but we are very diverse. You look at JMU and GMU, they in particular have kept their tuition rates very low, dealt with dual enrollment and other items, Longwood, some others, but they're much different than some of the other institutions. So
one of the things, Mr.
Yes, sir.
Chairman,
Senator Saslaw.
along those lines, you know, back in the late 90s, then Governor Gilmore froze tuition, and as a result, a lot of the colleges just had to start laying off some of the staff, and it was now taking an extra semester to graduate, so there was really no savings to anyone. The other thing is that if you look at schools with probably the two schools with higher tuition, one is UVA and I think the other is William and Mary, they are very comparable with their peer institutions around the country, Michigan and Berkeley, right, which are listed, you know, they're usually listed in the same category. So, and also study after study that's been published showed that UVA is one of the best buys in the country. So anyway,
renew the motion.
So I move that be, I think I'd move that be carried over for
Sure.
the year.
So that group of bill, all those in favor will record their votes aye. Opposed, no. The clerk will close the roll.
Ayes 15, nays 0.
Ayes 15, nays 0. The bills are rolled over for the year. Senator Saslaw.
The Senate Bill 435, we recommended by 3-2 that be passed by indefinitely. That said that it would write into the code that the primary duty of any board member was to the Commonwealth and not to the university whose board they had been put on, which quite frankly to me is a little unrealistic. I mean, I've never heard of any board member ever saying, geez, this is great for the university. I don't know if it's good for the Commonwealth. It just doesn't make any, didn't make any sense. We recommended it be passed by indefinitely, and I so move.
There's a motion second that Senate Bill 435 be PBI'd. Is there a second? There's a motion second that the bill be PBI'd. All those in favor record their vote aye. Those opposed, no. Clerk will close the roll.
Yeas 14, nays 1.
Case 14, noes 1. The bill is PBI. Senator Saslaw.
The final bill is by Senator Hanger, Senate Bill 656, Mr. Chairman. We recommend that be reported 5-0. The biggest change, there were several changes made, but the biggest change made is it will allow people to make small contributions rather than what was required before, and they can make them, I think, at their own frequency. So this, you know, there was no opposition to the bill of any kind, and so we recommended it. But this, you're right, the change in this would require this to go to Senate Finance, and I so move.
Motion is second that Senate Bill 656 be reported and re-referred to Finance. All those in favor record their votes aye. Opposed, no. Clerk will close the roll.
Yeas 15, nays 0.
15-0, the bill is reported and re-referred to finance. Senator Sasslaw, thank you
That
for all your
concludes. Thank
assistance
you.
here, and we're grateful for the work. All right, up next, I think what we were going to do is we're going to take a couple of the non-member bills, and before we get to some other bills, we do have a bill that relates to eye medicine that will come up something close to about 8:30. We may push it back just a little bit, but that's kind of the plan, and then hopefully we'll recycle the room for some of the other items that are coming up. Is Senator McDougal here? Maybe someone could reach out to Senator McDougal. I know that he's got a quick one. Next up is Senator McPike. You have a bill that's before us, sir.
Thank you, Mr. Chairman. Senate Bill 943. I know the committee has a long docket this morning. Senate Bill 943 seeks to update our code in relation to information exchange from DMAS with the managed care organizations. As many of you know, roughly 88% of our managed care is now handled through MCOs. This updates our code to allow the information exchange to take place with those organizations to better have the data exchange to serve those clientele. And so that's happy to answer any questions.
Perfect. Senator McPike, is there anyone here to speak in favor or in opposition to Senate Bill 943? Hearing none, is there a motion on the bill? There's a motion and a second that Senate Bill 943 be reported. All those in favor will say aye. I mean, record their votes aye. Opposed, no. And the clerk will close the roll.
Yeas 14, nays 0.
14-0, the bill is reported. Senator
Thank you, Mr.
McPike,
Chairman.
thank you for coming to see us today. Also, we do not have Senator McDougal here yet. Is Senator Wexton here? Okay. Next up would be Senator McClellan. Which bill are you going to take, Senator McClellan? Is that? Because we've got some in subcommittee. You
Yes.
need not speak to those.
No, I figured I'd do 910 first, if that's okay, or whichever order you want to take them in is fine.
Yeah, so we'll take up 9-10. Senator, you mind if Senator McDougal just goes quickly? Yours is going to just
Sure.
take a few minutes,
That's fine.
not long, but a couple minutes, and then we'll get right to you. Senator McDougal, we were calling for you. You
Thank you,
have
Mr.
one bill
Chairman.
before us, is that right?
Yes, Mr. Chairman, 959.
Okay.
Mr. Chairman, it's a very intriguing topic, disposal of unclaimed dead bodies. This came to me from one of the sheriffs, no good deed goes unpunished. I was in his jail looking at some of his other programs, and he advised me they were having tremendous expense because when somebody passes and there's no family member or other person to release the body to, the sheriff is responsible for the body. And they have to get a court order signed to release any unclaimed bodies. And that process takes time. And depending on where you are in the state, it's probably $70 to $100 a day is the expense for them to store the unclaimed body. And so this would set in place the ability for the court to authorize the clerk to issue the order releasing the sheriff from continuing to keep the body instead of having to wait for, in essence, a hearing, cutting down the time and the cost. Sheriff estimated in this one jurisdiction, it probably was the cost of at least one employee just in the fees he was paying to maintain these unclaimed bodies before disposal while waiting on court orders.
Well, Senator, I think after reading it, I don't think there's any opposition to the bill. Is there anyone here to speak in favor or in opposition to the bill? If not, Senator Black moves that the bill be reported. All those in favor say aye, or record their votes aye. Opposed, no. Clerk will close the roll.
Ayes 15, nays 0.
15-0, the bill is reported.
Thank you,
Senator
Mr.
McDougal,
Chairman,
thank you.
members of the committee.
And Senator McClellan, with my apologies, would you mind returning? And we will take up your bill, which is Senate Bill 910. And
Yes.
by agreement earlier, we are going to set a clock on that bill of about 3 minutes. We had a good long discussion with you and others last week, and so we're
Yes.
going to move through that. But you have a bill that you care a lot about, so you mind presenting your bill?
Okay. Ms. Chair, let me give you a little bit of background first as to why this is so important to me. In 2010, when I became pregnant, it was historic here in the General Assembly. Not only was I the first member of the House of Delegates to be pregnant while in office, it was the first time that my OBGYN had a legislator as a captive audience in her office. Over the course of my pregnancy, as I went in for checkups and ultrasounds, we had some discussions about how abortion laws could impact my pregnancy, and how they impact pregnancies that go horribly wrong. The doctor who administered my ultrasounds is a medical ethicist, and we had lots of discussions that opened my eyes to how abortion restrictions in Virginia law can impact his patients. He told me about Susie, a married 30-something with a hole in her heart who was on birth control but got pregnant anyway. Beth, who was a pregnant woman who had developed cancer. Each woman faced a heartbreaking choice whether to terminate the pregnancy or sacrifice her life. Mary, who underwent fertility treatments to have a child and got pregnant with octuplets. The odds of carrying the pregnancy to term were very low, but if she reduced the pregnancy to 2, the odds were better than 50-50 that those 2 would survive. Amy, who suffered an incomplete or missed miscarriage, in which the fetus dies but remains in the uterus, and a surgical procedure or medicinal abortion is necessary to remove the fetus and the placenta from the uterus. Robin, whose fetus developed the most severe form of spina bifida with horrific deformities. The doctor suspected that the baby was already paralyzed from the waist down, and the paralysis would spread as he grew. He was not expected to survive. My ultrasound technician said that whenever these cases were brought up, he often heard, well, that's not really an abortion, but it is. And because Virginia law does not distinguish between these types of abortions, all abortion laws apply to them as well. And I'll give you one example of what that can do. Under Virginia Code 18.1-76, prior to any abortion, a woman must undergo a transabdominal ultrasound to determine the gestational age and be given an opportunity to view the ultrasound image and listen to the fetal heartbeat. In all of the stories I just outlined, that is a devastating state mandate, which is also unnecessary because in those cases, gestational age would have already been determined. The woman would then have to wait 24 hours before the procedure, and if she purchases insurance out of the exchange or is covered by Medicaid, she might not have her procedure covered. For abortions performed early in the pregnancy, that transabdominal ultrasound is useless because the fetus can't be seen and gestational age may not be able to be determined. It took me 2 ultrasounds for my first pregnancy for gestational age to be determined, and that was through a transvaginal ultrasound. That mandate also adds additional costs. Comprehensive reproductive health care, including safe and legal abortion, is a vital component to a woman's overall health and should be protected. In its landmark decision on June 27, 2016, in the Whole Women's Health versus Hellerstedt, the U.S. Supreme Court affirmed that access to abortion is a fundamental constitutional right and clarified that the undue burden standard provides robust protections for abortion access. The Whole Women's Health Act codifies, this bill, Senate Bill 910, codifies the fundamental right to access abortion into Virginia state law, repeals state restrictions that impede access to abortion, and makes it illegal to enforce a new regulation on abortion that has no legitimate medical benefit. Laws that restrict women's access to abortion often harm the very women that they purport to help. The laws related to shutting down women's reproductive health care providers make it increasingly difficult and sometimes impossible for a woman who has decided to end her pregnancy, for whatever reason, access to a safe, legal, high-quality care that she needs. A woman's ability to access health care, including abortion, should not depend on her income, her address, or the type of insurance she has. These restrictions can create sharp disparities in access that are trebly reminiscent to a time before Roe versus Wade, when access depended on your economic status, your race, where you lived, or your ability to travel to another state. Leading medical experts and organizations, many whom are here, oppose medically unnecessary restrictions on a woman's health care services. Finally, abortion does not belong in the criminal code. In Virginia, if a medical provider induces an abortion or a miscarriage outside the express narrow definitions of the law, they could face a fourth-degree felony charge, earning from 1 to 10 years in jail. In the majority of other states, there is no criminal punishment, but a civil fine or other consequences under the state's medical licensing body. I know this is a very difficult topic, but the decision to terminate a pregnancy is a very difficult one. It should be made by the woman, her partner, her family, her faith, her physician, but not by the state government. And for that reason, I've introduced Senate Bill 910.
Thank you, Senator. Are there questions to the senator about Senate Bill 910? Senator Chase.
Thank you. Thank you, Mr. Chairman and Senator McClellan. I just had a question for you. On line 224, SB 910, it seems to strike the term physician as it currently appears in the code and replace it with healthcare provider. I don't disagree with what you're saying, but when I'm reading the language of the bill, it almost seems like this is a change of the scope of practice. You're changing the term. The way the original language is written is that it currently is a physician that is performing these, as it currently appears in the code, but now we're changing that to healthcare provider. And if I look up the definition of healthcare provider, I think there's a lot of concern there because we're including in healthcare provider that the definition includes dentist, pharmacist, it includes an optometrist, a podiatrist, chiropractor, and the list goes on. I don't know that you intentionally meant to change the scope of practice, but that in fact is what the language actually does.
Well, in other states, this language is based on what has been introduced in other states.
And this is, I'm just referring to Virginia State Code 8.01-581.
I understand. Okay, I'm going to phone a friend right now.
I understand.
Hi, good morning. I'm Agata Pelka from the Center for Reproductive Rights. So it's correct that that does remove the restriction. That's a physician-only restriction that can be provided, but only providers who are trained to provide abortion care will be able to do that. But it does remove the restriction that only physicians right now would be able to do it.
Okay, thank you for your comment, Mr. Chairman.
Senator Chase, yes.
But I would say, we need to look at what the language is. I know your intent is good,
Yeah.
and I appreciate that. But I'm looking at the language of the bill, and the language, according to the Code of Virginia, it has not been amended, and it includes optometrist, podiatrist, and these other groups. So that would need to, we need to take, whenever you're expanding the definition, I'm just looking at what the code defines healthcare provider as, and I'm just wondering, it seems like this bill is changing the scope of the practice.
Okay. All right. Is there any other comment about that? If not, Senator McClellan, I think we're going to change the clock from 3 minutes to 5 minutes. You've got a few more people here, but we're going to hold pretty hard on that 5 minutes. So if you just help your people move through that, that would be helpful.
I think they've been instructed to sort of combine where possible and
Okay.
that they'd be
Yes, ma'am.
limited. Thank
Okay.
you.
Thank you. With those that are in support of the bill, come forward, please.
Hi, so as I said, I was from the Center for Reproductive Rights. We were the lead counsel in the 2016 Whole Women's Health Supreme Court case. And I just wanted to note that Virginia's current TRAP restrictions cannot survive the constitutional standard that's articulated in this case. And for that reason, we support this bill as it would repeal those standards.
Thank you for coming by. Others that are here to speak in favor of the bill.
Good morning, committee members, and thank you. My name is Jessie Torrey. I'm the Managing Director of Whole Women's Health Alliance. We are a nonprofit organization committed to providing high-quality, holistic reproductive care for our patients, including abortion care. We have recently opened our clinic in Charlottesville, Virginia. I am really proud to be a part of this organization that challenged restrictive abortion laws in Texas, took it all the way to the Supreme Court and won. We won the victory in the whole women's health case, not just for Texans, but for people in this country all over, including Virginians. It is a privilege to stand here with you today and represent the organization for whom this very act is named. I'm also here representing myself as a Virginian. Abortion is a fact, abortion is safe, abortion is health care, and it must be protected. The Whole Women's Health Act ensures the fundamental constitutional right to access abortion and repeals unnecessary restrictions that are not medically necessary but serve only to shame and stigmatize women and impede their ability to access comprehensive medical care. I urge you to support the Whole Women's Health Act that will remove these unnecessary and harmful government intrusions into a woman's right to make her own medical decisions and access high-quality abortion care when and if she determines that's what she needs.
Great, thank you for coming. Appreciate you traveling to see us. Up next, and if you have written comments, because the people in the back of the line may not get there, I urge you to supply that to staff if you'd like. But welcome. Thank you for coming today.
Hello, everyone. My name is Kristen Glykoff, and my representative is Chad Peterson. So nothing is more devastating than seeing a friend in trouble and being helpless. My friend needed an abortion, but we were too young and couldn't drive and couldn't work. I tried selling my clothes, I tried raising money online, but it really wasn't enough. When she had no other option but to tell her unsupportive parents, they forced her to drop out of high school. Now I'm in college, and she's working on her GED. If more qualified providers could perform abortions, perhaps she could have traveled less expensively to a closer healthcare center. If second trimester abortions weren't limited to hospitals, maybe we could have saved longer. There is no doubt that each of these medically inconsequential regulations played its part, but not to ensure the well-being of my friend. Please support the Whole Women's Health Act and support women like my friend. Thank you.
Great, thank you. You have about 2 minutes left. Welcome.
Good morning. Thank you for the opportunity. I'm Dr. Wendy Klein. I am a lifelong provider of women's health care and dedicated to improving care. I just want to say that I strongly support this bill, which guarantees women the necessary care that they need and puts the state in concert with the Supreme Court whole women's health decision.
Great.
Thank you.
Thanks for coming. Others, welcome.
Good morning, Rebecca Gottwalt, Fairfax. Morning. When I was young, it was already difficult enough to get comprehensive reproductive care in some parts of Virginia. I was denied birth control help at County Health and fell pregnant. It was nearly impossible to find the resources and money to make the 120-mile trip to obtain a safe abortion. And this was before the trap laws were in place. These restrictions have closed more providers for no medical reason, putting abortion out of reach for some Virginia residents. We need to guarantee choice and bring the Commonwealth in line with the whole Women's Health Supreme Court decision.
Great, thanks. What next? Welcome.
Good morning. I'm Jacqueline Nantier Hopewell, the president of Prince William County chapter of the National Organization for Women. I'm here reading for Megan Kinkle. Good morning. My name is Megan Kinkle, and my representative is Senator Peterson. I am a registered nurse specializing in labor and delivery, and today I'm asking you to vote in favor of SB 910 and bring Virginia into compliance with the whole Women's Health Supreme Court ruling. Requirements like mandatory waiting periods purposely delays abortion procedures, which can jeopardize a patient's health and safety. A first trimester abortion is extremely safe with a risk of complication of less than 0.5%. As with many common medical procedures, the longer a procedure is delayed, the more the chance of a complication can increase. Furthermore, the risk of complication for a first trimester abortion is less than that of a wisdom tooth extraction. But why are clinics that provide abortion subject to stricter regulations than dental offices? Again, politically motivated barriers that single out abortion can hurt, not help Virginia women. Our patients rely on medical professionals like me to make the best decisions for themselves. The medical community does not need government interfering in our evidence-based, high-quality of care practices. To do so puts our patients and fellow Virginians at risk. Please support SB 910. Thank you.
Great. So, Senator McClellan, would the others like to just state their name and their support? Is that okay with you?
That's fine,
If you
and I think-
don't mind just stating your name and that you support, we'd love to hear that from you, yes.
Thank you, Mr. Chair. Jennifer Allen, Planned Parenthood Advocates of Virginia. We support the bill.
Thanks for coming by today. Yes.
Good morning. My name is Tarina Keene. I'm the Executive Director of NARA Pro-Choice Virginia, and we definitely support this bill.
Well, thank you for coming today. Others would just like to state their support? Yes. Hello, welcome.
Morning, my name is Casey Chavez from Fairfax, Virginia. I support this bill.
Great, thanks. Yes, ma'am. Hi.
Hello, on behalf of Caitlin Bunny, constituent of Senator Saslaw, she supports this bill.
Great, thanks. Hello?
Hello, my name is Michelle Wooten of Hampton, Virginia, and I support this bill.
Thanks for coming by today. Yes, ma'am.
Hi, my name is Jessica Lundberg from Alexandria, Virginia, and I support this bill.
Perfect, thank you. Yes, ma'am. Hi.
Good morning. My name is Nicole Graham from Alexandria, Virginia, and I support this bill. Thank
do
you.
too. Okay, good. Yes.
My name is Al Durante from Spotsylvania, Virginia, and I wholeheartedly and morally support this bill.
Great. Thanks for your help. Good.
Mr. Chairman, Scott Price from the Alliance for Progressive Virginia, and on behalf of our membership, we ask that you support this bill.
Scott, thanks for coming. Yes.
My name's Patricia Joshi. I'm from Stafford, Virginia, and I support this bill tremendously, and I hope that you do vote it out of committee. Thank you.
Thanks for coming. Yes, hi.
Deputy Secretary of Health and Human Resources, Gina Berger. I just want to let you know the administration does support the bill.
Perfect. Thank you. Anyone else? If not, Senator McClellan, would you like to wrap up and then we'll see if there's any questions?
I would.
We'll take opposition. I'm sorry, but why don't we do opposition first? The opposition, there will also be a 5-minute clock. I apologize. Would you come forward and state your concerns about the bill?
Good morning, Mr. Chairman, members of the committee. I'm Victoria Cobb with the Family Foundation of Virginia. Senate Bill 910 is the abortion industry's entire wish list, creating a fundamental right to abortion in our code. Everything they could possibly do to increase the volume of abortion and thus profit, with little concern for the emotional or physical well-being of women encountering this decision, and certainly no regard for the unborn in the path of destruction. This proposal removes all information that might allow a woman to make an informed decision, and which, even if she still chooses to go through with the abortion, would reduce the amount of regret after this life-altering decision. It also denies a woman the ability to see her ultrasound. This bill removes the standards that this body put into place to ensure that abortion facilities are safe. Since putting these standards into place, hundreds of safety violations have been addressed, including blood on the tables and medical equipment, mishandling of Schedule II narcotics, and the list goes on. But more than just removing the safety standards, this bill allows these would-be now uninspected centers that have shown themselves to be problematic during the inspections to now be doing second trimester abortions. The bill has 20-plus week abortions happening outside of a hospital. In this brave new pro-abortion world created in this bill, unless a woman is getting a later term abortion, she would not even be guaranteed a doctor would perform her abortion. Instead, she might have a surgical abortion performed by a midwife. One of the most egregious parts of this bill is that it vastly widens the currently narrow rationale where our law allows a third trimester abortion by no longer requiring that a woman's physical or mental health be substantially and unfixably impaired by concurrence of 3 doctors to legally have a second or third trimester abortion. This bill creates abortion virtually on demand up until the point of birth. I don't think this committee, nor the larger body, wants to give its stamp of approval on the taking of life up until its birth. Sadly, this bill admits what we've known all along, that despite claims that abortion sympathizers only oppose clinic safety because supposedly the centers are already safe, despite claims that they only dislike informed consent because it has an ultrasound involved, and despite claims that when we're addressing abortion law, we're basically just talking about a blob of tissue in the early stages of life, this bill makes it clear that abortion industry and its sympathizers want it all. Unregulated, late-term abortion being performed by nurses and midwives, not even physicians. I'm disappointed I'm even having to stand here to talk about this radical shift of policy that is happening in concurrence with the fact that every year more and more Virginians are pro-life. Thank you.
Okay, guys, you have about 2 minutes left. Welcome.
Eddie Aliff, Virginia Assembly Independent Baptist, and while I know that we are opposed to abortion in general,
we realize that there are folks in our churches that do take advantage of this. And we would want the safest possible facility for these women who are doing making a very difficult decision. And therefore, we prefer not to see any of the changes that are put forth in this bill. Thank you.
Thanks for coming. Welcome.
Mr. Chairman, members of the committee, thank you. Bill Ray with the Virginia Catholic Conference. I just want to make a few brief points. One, our contention is that abortion is not health care because it doesn't save lives, it ends them. Abortion is not safe because when it works properly, someone dies. But I will add one more thing. As long as our many social services and charities remain open, there are no unwanted children. I would say to anybody facing an unplanned pregnancy, please give us the child. We want the child. We have adoption services. We want the child. Give us the child. Thank you.
Thanks for coming. We've got about a minute left. Yes, ma'am. Welcome.
Good morning. Louise Hartz from Henrico County, representing the Virginia Society for Human Life. For 51 years, Virginia Society for Human Life has been there to protect the lives of the unborn. We oppose this Senate Bill 910. Thank you so much.
Thanks for coming. All right. With that, we will stop the clock. And Senator, why don't you wrap up, and we'll have some discussion within the committee and vote.
Thank you, Mr. Chair. Look, I know this is a very difficult, a very controversial decision. But these are decisions that are not made lightly. And these are decisions that, like any other medical procedure, should be between the person involved and their physician. And too often, when the General Assembly has put in place restrictions, they have far-reaching consequences that impact not just unwanted pregnancies, but wanted pregnancies that go horribly wrong. We have an opportunity to correct that. And all I would say is, you don't need the state code to determine how someone is going to feel when they've made the very difficult decision to terminate a pregnancy. And I would say you don't reach your second or third trimester and wake up one day and decide, I just don't want to be pregnant anymore. Usually there are very serious complications and reasons why you are making that decision. And too many of our laws in place don't take that into account. And I thank you for your time.
Perfect. Thank you for coming. Thank you for your presentations. There discussion or motion on the bill, Senate Bill 910? All right, there's a motion to PBI and a substitute motion that the bill be reported. The primary motion now will be that the bill be reported. All those in favor of reporting the bill will record their votes aye. Those opposed, no. The clerk will close the roll.
7 days 8.
Ayes 7, nays 8. Without opposition, the bill will be flipped for PBI. Senator, I also want to thank you for your help on Senate Bill 238, Senator DeSteff's bill. I think we're going to take your suggestion on that, but you don't need to stay for that. But we're grateful for your help.
Okay.
You also had a bill that was in subcommittee.
Yes, two. The first one, Senate Bill 455, I believe, has been incorporated, or the committee is going to move to incorporate it into Senator Dunavant's 329.
That's right. And you don't need to be here for that. As long as you're okay with that,
I am.
We'll move forward.
And then the last one, which was also heard in subcommittee, is Senate Bill 456. I do have some technical amendments that were requested by the Department of Education.
Right. Tom, do you have those technical amendments? If so, then the senator can just you don't need to stay. I think we're in good shape on that bill.
All
if
right,
not, we'll give you a call. How
thank
about
you
that?
very much.
Okay, good. Thank you very much. All right, next up is Senator Wexton. You have a bill before us.
Two bills before you, Mr. Chairman, I believe.
What do you have? You have two bills that are not in subcommittee, and why don't we take up 436 first?
Very good, thank you, Mr. Chairman. Senate Bill 436 would add fentanyl derivatives to Schedule 1. It would put another tool in the toolbox for law enforcement as they work to respond to the heroin opioid epidemic that's gripping the Commonwealth. I don't have to tell this body that overdoses continue to rise in Virginia despite our attempts legislatively. and otherwise to stem that tide. The problem isn't just heroin and prescription drugs. Increasingly, it's those substances mixed with fentanyl, and not the kind of fentanyl that's approved by the FDA and has some limited medical uses. We're talking about street fentanyl, which is made in illegal labs and trafficked in from abroad often. It's increasingly available and it's increasingly lethal. The bad guys are generally one step ahead of us. As soon as we add a new fentanyl derivative to the code, new ones pop up. They make small changes to the chemical compound, and we're always a step behind. So we need to make the code more nimble, as we did for cannabimetics a few years back. This bill would amend the code by deleting acetylfentanyl and the 14 specified chemical compounds from paragraph 1 and adding a new paragraph 7 that specifically defines fentanyl derivatives, including the base compound and the compound groups, and including but not limited to the 38 specifically currently recognized fentanyl derivatives from within those compound groups.
So, Senator, I think we've read the bill pretty good. I think it's in good shape unless you see any
It should be,
amendments.
Mr. Chairman, and I certainly don't want to talk
Sure.
the...
So maybe we got about 73 bills today. Maybe if there's someone that wants to speak in favor of the bill, I think we're in good. Unless I'm missing something, I think it's a pretty good. It does have to go to finance, but beyond that, I think it's in good shape.
Good morning, Mr. Chairman, committee members. I'm Caroline Jurin, Executive Director of the Virginia Board of Pharmacy. The governor supports this bill.
All right. There's a motion and a second that the bill be reported and referred to finance. That's Senate Bill 436. All those in favor record their vote ayes. Those opposed, no. And the clerk will close the roll.
Ayes 15, nays 0.
Ayes 15, noes 0. The bill's reported. Senator, you have up next Senate Bill 440.
Yes,
School
Mr.
boards.
Chairman. And switching gears a little bit, this is a bill that was requested by Loudoun County Public Schools or Loudoun County School Board. And it makes a very small change to the code in this section, deleting A and inserting an appointed school board. What this bill would do is allow elected school boards to sue another government body without, or become involved in litigation with another government body without seeking the permission of the County Board of Supervisors. This appears to be a holdover from the time that we had appointed school boards. This arose out of a case where a Loudoun County citizen initiated litigation with the Department of Education and making allegations about Loudoun County Public Schools privacy. Maintenance for teachers, and the school board wanted to intervene and had to seek permission. Actually, the law was unclear, and this would make it absolutely clear. That they
Thank you. Senator Carrico. Oh, okay. All right. Is there those that are here to speak in favor of the bill?
Good morning, Mr. Chairman, members of the committee. Jeremy Bennett with the Virginia School Boards Association, and we are in favor of this bill giving more authority to our local boards.
Perfect. Okay. Anyone here to speak in opposition to the bill? Senator, we got a long day. I have some struggles with it, but I'm not going to go into it. But is there a motion on the bill? There's a motion and a second that the bill be reported. David, would you like to speak? No. All right. The motion is that the bill be reported. All those in favor record your vote aye. Those opposed, no. Clerk, close the roll.
Yeas 8, nays 7.
8-7, the bill's reported. Thank you for coming down today. I appreciate your help. All right. Up next, and those of you that are in the audience, we have, and Senator Sudeline has requested that we work through a compromise on the ophthalmology bill. And I'm told a couple of times that we're very close to coming to something that both sides will be acceptable to, and therefore that 8:30 time is going to be postponed to a later time. So we were delighted to have you here, but we're hoping to take that bill up at around 9 o'clock and 9:05. We're still going to stay on track for the 9:30 for Medicaid expansion legislation. So with that, Senator Wagner, are you still here?
Chairman, he's Ms. Hall.
Yeah, okay. And then up next is Senator Marsden. Welcome, sir.
Thank you, Mr. Chairman. Senate Bill 303.
Senate Bill We're going to take that up in the Public Education Subcommittee, so you need not be here. The action that took place there is likely to be it. Do you have another bill before us? Which bill is it? Oh, Senator, that one did get a bit of a review. We're just not going to take it up right now. We're going to get the subcommittee report before us, and so if you don't mind, sir, we're going to have we'll call your office and bring you right down. How about that?
I appreciate it. Thank you.
Yes, sir.
Yes, sir.
Good. Up next is Senator Servell. Are you here? No. Next is Senator Favola. Senator, welcome. We're delighted to have you here. You have Senate Bill 300. Is there another?
Yes, Senator Chase has a similar bill.
Is there another bill you have before us, ma'am?
No.
Okay. So what we're going to do is we've heard this a lot. We really like to have you come here, but we've heard a lot. So we're going to hear from you, hear from Senator Chase, make sure there's not any different comment in the audience, and then we're going to vote on that bill. So you want to present your school calendar bill for us?
Yes, Mr. Chairman, I will be very brief, and thank you for the opportunity to present. This bill would grant local school boards the authority to set their own calendars. What is different about this bill than perhaps past bills is there's actually language that would require school systems to not have school the Thursday before Labor Day. And then, of course, they would have Labor Day off. So this, I'm through the Tuesday succeeding Labor Day. So we've tried to accommodate concerns by some interest groups who felt that having Labor Day workers and Labor Day visitors to different entertainment venues was important. So with that change, I think that would be really helpful for schools that have been granted waivers prior to the 2011-2012 school year. They wouldn't have to abide by the language I just said, but waivers that were granted in subsequent years would be.
Senator, we have a substitute on your bill. You mind if we pass that substitute? So the motion and a second that the substitute be agreed to. All those in favor will say aye. Opposed, no. And substitutes agreed to. Senator Chase, you want to tell us about your bill? And we'll look at the differences real quickly, and I think we'll be in good shape.
Thank you, Mr. Chairman. I think Senator Favola has done a great job, so I'm not going to duplicate anything she's so eloquently provided here. I just want to say one thing, and that's this. I do not feel like our businesses should be determining when our schools open. That should be for the elected officials of our school boards who are elected by the people that represent us. And we are taking this decision out of their hands where it should be, and we've allowed for decades to allow the businesses to determine that, and I think that we need to change that policy. So I agree with Senator Favola and appreciate being able to patron on this bill together, and hope that this year that this committee would decide that this is the right thing to do, and allow our school boards to do what they were elected to do along with our parents who elected them. Thank you.
Thank you, Senator Chase. Thank you for the presentation.
Mr. Chairman, I do have some speakers. They can be very quick.
Okay.
It's up to you.
What we'll do is we'll have a motion that we will roll Senate Bill 300 into Senate Bill 914. There's a motion and a second to roll the bills together. Motion and a second. All those in favor will record their vote aye. Opposed, no. Clerk, close the roll. So we have the one bill before us. So we're going to set a clock for 3 minutes, if you're okay with that, Senator, and we'll just hear from those that are supportive and those that are in opposition. Welcome.
Mr. Chairman, members of the committee, Tom Smith of the Superintendent's Association. We've been long in support of this idea and wish you to consider it to move it forward. Thank you.
Mr. Chairman, members of the committee, Jeremy Bennett with the School Boards Association. We are very supportive of this bill, and I'd like to echo the comments made by Senator Chase on giving local boards the proper decision-making authority. We are very supportive of this bill. Thank you.
Mr. Chairman, members of the committee, Michael Malloy, Fairfax County Schools. Just echoing the comments of my colleagues, we're very much in support of this measure. Thank you.
Mr. Chairman, committee members, my name is Sean Smith. I'm with Chester County Public Schools. I want to thank Senator Chase and Senator Favola for introducing these bills. This gives us some much needed flexibility on behalf of our 60,000 students and 8,000 employees. We really support this bill and hope you'll move it to the Senate floor for full discussion.
Well, thank you all for coming. Are there those that are here that are struggling with the bill? If not, Senator Suderline.
Mr. Chairman, I'm surprised that there's no one speaking in opposition of this fine bill.
I don't know, there are some speakers over here, so I mean, Mr. Chairman, you may want to
go
acknowledge.
first.
I apologize. I didn't see you that way, but we'll send the same clock on you, but welcome. Thanks for coming today.
Thank you, Mr. Chairman, members of the committee. Joe Wertz, Virginia Restaurant Lodging and Travel Association. Obviously, this is not my first time before you in opposition to this bill. The economic impact that this would have on our industry would be substantial. When we discuss the Labor Day weekend and the high tourism season, we're not just talking about that specific weekend, but we're really talking about the 3 weeks prior, where proportionally a much larger part of our revenue is generated. So we oppose this bill, and we hope you do the same. Thank you.
Great. Thanks for coming. Yes, sir. Welcome.
Mr. Chairman, Jack Berry with Richmond Region Tourism. I represent Chesterfield, Hanover, Henrico, New Kent counties in the city of Richmond. We're opposed to this bill, and I also represent the Virginia Association Convention and Visitor Bureaus from throughout the Commonwealth. And we're against the bill. Thank you.
We're grateful you came today. Thank you for coming. Yes, welcome.
Mr. Chairman, members of the committee, Angie Bezick on behalf of the City of Virginia Beach, we also oppose this bill.
Perfect. Okay. Thank you very much.
Mr. Chairman, I just want to make 2 closing comments. Both Senator Chase and I have worked with the owners and operators of the various entertainment venues, and the fact is that many of their workers are not high school students. They're, for the most part, bringing folks over from other countries. So I'm not sure that the employee need is as obvious as it's been stated. But most importantly, some of the AP exams, the schedule is set by the federal government, and those exams are often administered very early in the school year. So school systems where they can start school prior to Labor Day, their students have more preparation time. At the end of the day, we're asking our school systems to provide a quality education and to give our students every opportunity to succeed. This should be about academic achievement. Our school systems know best what calendars best coordinate with the different testing requirements and the academic calendar. We should leave this decision to the local governments, local school boards.
Senator, thank you very much, and thank you for your discussion. Just so that the committee understands, in previous years, the senator from Northern Fairfax and I sit on in finance have had an amendment on the bill that basically have said that that if you had the exemption before, you continue to get the exemption, which covers a vast majority of the state.
61%.
This year, we're delighted to see that that is embedded in the governor's budget. So whether this bill passes or doesn't pass, for the most part, all those exemptions will continue. Senator Suderline.
Thank you, Mr. Chairman. I always enjoy our annual debate with the Democratic and Republican leaders on this bill. I support the bill. I thank you for bringing it. I see the Democratic leader has just arrived, so we might get to have that debate. But if we don't and the bill does not advance to the floor, it would be great to have that debate. I do hope that Senate Finance and our budget negotiators will be sure to include this in the budget, because our local school boards should be making a decision about when the local schools start.
Mr. Chair?
Yes, Senator Peterson.
If I could add to that, and I have 4 children in Fairfax County Public Schools. This is about truth in school openings. Fairfax County Public Schools opened a week early this year, okay? So this already happened, and the state economy didn't collapse, okay? So the bottom line is, this is already happening, folks. So a lot of folks in this body probably doesn't know what's going on with the school system because they don't have kids in the school system. This is happening anyway. So it's time to update the laws to what is actually happening. Thank you. So I support the motion.
Great. Senator Howe, do you have a motion? Yes, you do, I think.
I move to report and refer to finance.
Okay, it's a motion and second that the bill reported and re-referred to finance. All those in favor will record their votes aye. Those opposed, no. Clerk, close the roll.
He's gone.
Okay. Report the roll. Yep.
Ayes 5, nays 10.
All right, the bill does not report and refer to finance. So with that, we will flip the vote, and the bill will not pass. It does plan to still be in the budget. Mr. Suderline, yes.
Mr. Chairman, I would suggest instead of flipping the vote, if someone that doesn't like the bill wanted to PBI, so those of us that do favor it but don't think this should be going to finance, because I don't think the 5-10 vote would reflect.
Okay,
a
is there a
regular
motion on
report.
the bill to pass by indefinitely?
All right.
Motion is second that the bill be passed by indefinitely. The clerk will open the roll. All those in favor will record the vote aye. Those opposed, no. The clerk will close the roll.
Close.
8-7, the bill is PBI'd. Thank you for coming today. Very
close.
kind of you to come.
Thank you,
for
Mr.
that.
Chairman.
I'm consistent.
Okay, up next, there is not yet the ability to move forward with the ophthalmology bill. Therefore, we will take Senator Wagner. Why don't you come forward with your bill? You have something that is not in subcommittee. Senator Wagner.
I have two bills, Mr. Chairman, that were apparently on the docket. One of them I'm going to ask you to strike. I think we have some peace in the valley.
Hold on. All right, Senator Wagner, what is that bill?
That bill is Senate Bill 891, and I would ask that the committee strike that bill.
There's a motion second that Senate Bill 891 be stricken from the calendar. All those in favor will record their votes aye. Those opposed, no. The clerk will close the roll.
Yeas 14, nays 0.
14-0, that bill is stricken. Senator Wagner.
Yes, sir, Mr. Chairman. I now have Senate Bill 658. And what 658 does, Mr. Chairman, and it's a recognition that we have
Okay, I think that bill's in good shape. You went to subcommittee, they liked it, and I think we're good, and they're going to make a presentation, so I don't think you need to stay unless you just desire to do so.
I like this committee better and better, Mr. Chairman.
Yes, sir. Okay. Very good. With that, is Senator Servell here?
Right here.
Okay. You want to come forward and speak to your bills that are not in subcommittee,
have
which
one.
includes 787.
I think it's only one. Yeah, it's only one bill, Mr. Chairman.
Would you go forward? Is that with 787? Is that okay with you, sir?
Yes, sir.
Yes, go ahead and make your.
Thank you, Mr. Chairman. And ladies and gentlemen of the committee, Senate Bill 787 is a bill that has to do with the governor's schools. It actually has to do with one governor's school, the way it's drafted, which is Thomas Jefferson School for Science and Technology. And I have some statistics I'm going to hand out here for you. But TJ, that's what we call it in Northern Virginia. TJ was opened in 1985 when I was in 8th grade. I was in actually the very first class that was offered admission to the school. And it's a very different school today than when it was originally, from what it was originally envisioned. It's for those of you who don't know, it's a school that focuses on science and technology. They admit students from not just Fairfax County, but from Arlington, Alexandria, Prince William, and Loudoun. Although Loudoun is creating their own science and tech focused school to get out of TJ, and they also admit a lot of private school kids. And you'll see the chart I'm handing out. What I basically did was I took the admission data for the class of 2007, which shows the number of applicants, the number of semifinalists, the number admitted. Then I have the acceptance rate, and then I have the free reduced lunch meals percentage of the middle schools for which those kids came from. Basically, the school has had excellent results in terms of academics. I mean, they have a lot of national merit finalists, semifinalists, things like that. They win lots of awards. If you look at the performance, it's one of the best performing schools in the country. But the reality is this school doesn't even come close to reflecting the reality of people within the county that it purports to draw students from. So where Fairfax County's school population has 30%, 1 in 3 kids has free and reduced meals, Thomas Jefferson, the student population is 2%. If you look at these admission statistics, and you can see why. If you attend a school that has 15% or less free reduced lunch meals as your population in middle school, you got a 1 in 3 chance of getting in. If you attend a school that, in my part of the county, you got about a 1 in 10 to a 1 in 20 shot of getting in. Or in the city of Fairfax, by the way, which didn't admit a single kid in the class of 2020. So there's something going on within our school system in Fairfax County where certain children aren't being encouraged or educated in a way that enables them to get in. And this has been a Fairfax County School Board member 5 years ago, and the Fairfax County NAACP filed a civil rights complaint against the school because it's patently wrong. And since then, nothing's happened. And there's been many of us complaining about it, and nothing's happened. And given that my school board seems completely incapable of dealing with the problem, I figured it was time for the legislature to do something about it. So, I mean, this is a governor's school. This is a system we set up. It's a system we create. There's only so many governor's schools in the state. But if this is what our governor's schools are going to be, if they're going to be, if they're going to be private academies, taxpayer-funded private academies for rich kids, then I don't think that's a program that we ought to be authorizing. And so, basically what this bill says is that if you're going to have a governor's school like this, the free reduced lunch meals population of the student population has to be 50% of the weighted average of all the schools that go in, which would be about 15%. And it puts an admissions cap on the schools at 15 and says they have to admit 5 from every middle school they pull from. And that would give it a more balanced system that looks a lot more like the county, and it would be, I think, a lot fairer. And so that's why I put the bill in, and I hope the committee would act favorably on it. I think there's a former counselor from Rachel Carson, which if you look at this list, admitted 98 kids in the class of 2020, whereas the middle schools in my part of the county either got 0 or 0 to 5. And she can talk about a little bit about what happens and what she saw at the school she goes to, or she used to teach at.
Senator Serville, you do a great job presenting your bill. Senator Saslaw.
Yeah. Senator Serville, you made the remark that this is a school for rich kids. This school draws from Alexandria. No, it does not draw from Alexandria. Arlington, Fairfax, Prince William, and Loudoun.
Right.
Okay. That region that I just named has approximately 12% Asian population, yet they're close to 70% of the school. Okay?
Yep.
Not wealthy people, but what they do is they have a substantial amount of programs set up for these children for extra, to get them ready to take that test, which is probably 80 to 90%. This school has been based strictly on merit only.
Yep.
And has never changed. They started, their first class was in 89. Since then, they've had 8 Rhodes Scholars. They have research labs that some of the colleges in this state would be the envy of. And it's been strictly merit-based. And so help me, I see absolutely no reason to change that. It is not based on wealth. It is based on preparation. And I have no problem trying to change curriculum in Fairfax or wherever to, boost, the learning of these children or give them the topics that are necessary, but to simply lay down a blanket requirement that they have to take 50% of the people who are on, free and reduced lunch?
That's not what it says. It's 50% of the weighted average, so it would be about 15% would have to be free reduced lunch.
Well, I just can't see taking a school that has just excelled, and U.S. News and World Report has called from time to time the top high school in America, and changing it because you can't get kids in from Route 1.
All right, guys. Senator
Mr.
Locke.
Chairman?
I'm sorry, and then
And the school system's here. I'm sure they have a problem with it. They're here as well.
Senator Locke.
Mr. Chairman, I have, how is it determined who is admitted to the school? Who makes that determination?
There's a test they have to take. They have to get recommendations from their teachers, and I don't think there's an interview, but it's mainly a test.
It's the test. Not
Oh, it's an essay too. Okay.
And an essay.
Senator Locke.
Okay, and what is the percentage of, what's the breakdown of, in terms of students over time who have been admitted to this school in terms of of who's actually been admitted to the school? Where are they coming from?
This chart I gave you sorts it by middle school. And Rachel Carson is sort of the Great Falls area, Longfellows Falls Church. These are mainly schools in the wealthier parts of Fairfax County. The eastern part of Fairfax County, which I represent, everything east of I-95, didn't have one national merit semifinalist last year out of 6 or 7 high schools. I don't think the kids in my part of the county are any dumber than the kids in the rest of the county, but apparently they just can't get into TJ.
Okay.
One final
Senator
question.
Locke, yes, ma'am.
Why did the NAACP find it necessary to file a lawsuit?
NAACP filed a complaint because African American and Hispanic Latino children can't get in. Latino kids make up 25% of Fairfax County's overall student population. Black children make up 10% of Fairfax County's student population. At TJ is 2% Hispanic and 1.5% Black. And the NAACP is tired of those results and thinks they're discriminatory. That's why they filed their complaint.
Okay. Next up is Senator Cosgrove.
Thank you, Mr. Chairman. Mr. Chairman, I was privileged to chair a 2-year STEM study group. We actually visited Thomas Jefferson. It is absolutely an amazing facility that takes the best and the brightest of students. I mean, kids start working to get into Thomas Jefferson in middle school. They work so hard to get there. And I think that if we start fiddling around with the admissions policy for Thomas Jefferson, we're going to make it a weaker school. Not that any children are better or less than others, but these are kids that have worked for many, many years to work to have admission into one of the finest high schools in the entire country. So, Mr. Chairman, I think it's a terrible idea to mess with something that's working so well. It is working so well. And when we talk about workforce development, and we need engineers, we need mathematicians, we need chemists, we need physicists, a lot of them are coming from Thomas Jefferson.
Okay.
And so it's not often that Senator Sasslaw and I are aligned together, but I'm arm in arm with him on this one. I think we just need to leave this alone.
All right.
Thank you.
Thank you, sir. Senator Howell.
Well, let's make it a really odd trio because I agree with Senator Cosgrove. We have one of the best high schools in the country. It could use some improvement on some of the admissions, but it's based on merit. And I don't think we down here have any business meddling with the decisions of the Fairfax County School Board on this issue. Typically, we leave these to the local school boards, and I think when they have such a success, there's no reason for us to do anything that might deter from that. And basically, quotas are a really politically charged topic, and I don't think we should be going there.
Okay. Senator Peake.
Yes, Mr. Chairman, this goes against absolutely everything that we want as a state level to start telling local school boards the percentages of students that they're going to have at the school. It is an elected school board, isn't it?
Yes.
And it's run by the Fairfax, Mr. Chairman, run by the Fairfax County School Board?
Yes.
Okay.
Nothing further.
Mr. Chair.
All right. Very good.
Mr. Chair.
Yes, Senator Peterson.
And I just want to, first of all, I appreciate your shining a light on Lanier Middle School, which has 3 alumni in the state senate, I might add, which I think is unprecedented. One of the issues, Scott, is that kids that come up through Fairfax County Public Schools often get steered into advanced studies program at certain middle schools.
Right.
And so that's why certain middle schools are going to have, 60, 70, 80 kids. It doesn't mean necessarily that the other middle schools are failing. It's just the best and the brightest kids get steered into the top middle schools through these AAP programs. We fought to get one into Lanier Middle School, and we finally did this year. So that's a separate issue from this. One of the issues is, I'll avoid sort of all the racial politics, but there's also a lot of intermarriage in Fairfax County. And you're going to try and start classifying people based on race and limiting if they can get in or not get into school. You're going to go down a whole different path.
Well, my bill didn't say anything about race.
All right.
But
So
that's
guys,
kind of the subtext.
Senator Thank you very much.
And I have one witness too at some
And
point.
so what we're going to do is we're going to get
She'll speak in favor.
about maybe a couple of presentations real quickly, and I'm going to put a clock of 3 minutes on it, but we're going to take less than that. Those that are here to speak in favor, welcome, ma'am. Thank you for traveling down to see us.
Good morning. I'm Patricia Heining. I'm a retired teacher. I taught for 30 years in Fairfax County, and the last 7 I was at Rachel Carson Middle School. And what I would like you to understand is Carson is a great school, but just because the kids achieve well, that doesn't mean it's a better school than another school. It's partly what you're given. I also spent 8 years of my career at Annandale High School, one of the schools that has a lot of students with challenges. I watched kids given an opportunity who didn't have support at home earn a full IB diploma because people chose to lift them up. What you need to know about Carson is there is a pipeline. Carson is not helping these kids get in. And what's happening is the parents have figured out the formula. Certain communities make sure that their kids, starting early on, get into every competition you can get in. They are ravenous about, there's a math test my kid can take, he's going to take it. The parents started a debate team at Rachel Carson. They hold auditions for it. They run the debate team because they want the kids to win and have something to put on their little resume. Many of the activities, science Olympiad, math counts, etc., they're limited to 30 kids. I've watched 200 kids stand in the hall lined up to audition for science Olympiad, but only 30 kids could get in. The parents have paid for extra classes, John Hopkins programs in the summer for gifted students. The cram course for the entrance exam for TJ starts in 3rd grade. Google a Washingtonian article. You'll see a picture of these little 8-year-olds sitting in a classroom learning how to prep for the TJ exam. So these kids are set up for this kind of thing. So a regular kid who's an excellent student, loves math and science, but mom and dad don't know to put them in all these things or can't afford it. I found one prep session online last night, 2 months of prep, $1,000. You take it right before the exam in the fall. Not everybody has that money. Not everybody has the savvy, but these parents have communicated. I understand that the Embassy of Korea has a link to TJ admissions. I taught many kids who came here from India specifically to attend Carson and TJ. Specifically, the parents come here, however they come here, put the kids in Carson, pipeline to TJ. That's the way they look at it. People move right before 7th grade to get into Carson so that they can go to TJ. So I feel that there's a pipeline. There are parents who are buying their kids a seat at TJ. Not all children have this same opportunity, but they have the aptitude.
Articulation that very, very helpful. We appreciate your help here. Are there those that are here to speak in opposition to the bill? And if you could avoid clapping, it just helps it all move through. 73 bills is going to be a lot today. Welcome. You have some concerns about the bill?
Yes, sir. Mr. Chairman and members of the committee, I'm Michael Malloy representing Fairfax County Public Schools. We very much appreciate the senator's kind of focus on equity and access. And actually, our new superintendent, who just started a few months ago, agrees with that being a priority. He's created a new position in the school system, Chief Academic and Equity Officer, and the TJ Admissions Office is constantly undergoing review in terms of its admissions policy. The reality is TJ is a very highly competitive. It's a very highly competitive school. Only about 17% of all applicants get into TJ. You've got an essay, you've got assessments, and then you've got teacher recommendations. So it's a very highly competitive process to get in there. We welcome this discussion, but we don't think that this is the right venue for it. We think this discussion should be held among our constituents, among our stakeholders, and we hope you wouldn't support the bill.
We're grateful for you coming today. Others are here that have concerns about the bill.
Mr. Chairman, members of the committee, Jeremy Bennett with the School Boards Association. We have concerns with the bill regarding its limit of local control of the locally elected school board. And for that reason, we feel that decisions in terms of enrollment should be made at that level. And for that reason, we're opposed to the bill.
Great. Senator Serville, got about a minute to wrap up and we're all done.
Easy. First of all, Mr. Chairman, I would say to Senator from Chesapeake, Senator Cosgrove, with regard to the facility. This school gets investment from the private sector that other schools in the county can only dream of. The other schools in the county just can't compete. All the corporations, they want to put all their money in so they can have all these fancy wind tunnels and laser labs and stuff that other children in the county have no access to and could never get because they just can't attract that kind of private sector capital and attention to their schools. And so it's a wonderful facility, but it's not fair because not everybody gets to use it. With regard to meddling in the local school board, I totally appreciate that. The problem is this issue has been this has been an issue for 10 years, and the local school system hasn't dealt with it, and the school board won't deal with it. And it's because it's been 10 years of people complaining. I think it's time for us to step in because we're the ones that created governor's schools, and we need to step in and send them, or we need to maybe send them a message that we want to see something done about it. We want to see this addressed, or that we will step in. So, and I'm sensitive to that.
Well, Senator Serbell, well done on your presentation. What is the pleasure of the committee?
Mr. Chairman,
Yes, Senator
as a
Cosgrove.
1972 graduate of Annandale High School, go Adams. I moved to PBI.
There's a motion and a second to PBI. All those in favor of PBI will record their votes aye. Those opposed, no. Clerk, close the roll.
Yeas 13, nays 1.
Ayes 13, nays 1. The bill is PBI. Senator,
Thank you
for coming by. Up next, Senator Suderline has the optometry, ophthalmology bill. Senator, do you mind taking the stage up there? Great. So. All right, Senator, why don't you present briefly the.
Yeah, sure. 1 second.
All right, so let me tell you what we're going to do. The senator is going to present briefly. The senator did ask, along with a number of others this morning, that the both sides look at a compromise that would be reasonable to both. That, I understand, has been accomplished. Tom will present that, but David, why don't you present your bill briefly? We're going to hear from both sides, and we do have now limited time on the bill because the Medicaid bills will be taken up quickly. Welcome,
Understood. Thank you, Mr. Chair. The bill is Senate Bill 511, if you haven't had that number scored into your head yet. Senate Bill 511, the intent is to allow optometrists to be allowed to work on eyelids for Virginians that have eyelid issues. This has been something that's been done in other states. You've heard a lot of rhetoric about we'd be one of 3 states that do this. You know, what this bill all along sought to do is take us to where about 18 other states are. Today, we've had a lot of great discussions with folks on both sides of it. And we have a substitute that we need council to work on with us. So, make sure I have the right version because we've discussed this several times.
So David, are you getting ready to prepare what's going to be in a substitute, or are you
Yes.
planning for? All right. So,
and I think that there's some folks that would like to speak on their thoughts on the substitute, and we'll see if that's agreeable to the committee and if we should move it.
all right, we'll postpone the motional substitute until we hear. But go
Okay.
ahead and give us the basic outline.
Mr.
Yes.
Chairman, good morning. John Garrett Kemper on behalf of the Virginia Society of Eye Physicians and Surgeons. Let me just run through. First of all, let me thank the patron and Senator Suderline and Senator Newman for putting the parties together. We've been working diligently, as you've probably heard over the side. So let me talk about what the bill originally did and talk about what the substitute is. The bill originally allowed optometrists to perform surgery in the treatment of styes, chalasia, and lesions on the anterior segment of the eye. It also allowed injections for local anesthesia, the same. What the substitute does is it does not allow optometrists to perform surgery. It allows
Mr.
them
Chairman,
to treat.
I hate to interrupt, but do we have the substitute?
Just if you don't mind, it's a good question, but if you don't mind, I think we're going to hear a couple things because there's going to be a little discussion this time about the substitute, but we will get it at least in concept before us soon. So,
The idea is to
John,
make sure it's agreeable to the committee.
I understand. Go
Senator
ahead, John.
Cosgrove, I apologize. We just had it in concept, and so, yeah. So again, no surgery. Number 2, it allows optometrists to treat chalasia through injectable Schedule 6 steroids with education requirements that they've been trained in this and certification from the Board of Optometry that they've been certified to do this. So we've gone from surgery and local anesthesia with no educational requirements to the treatment of chalasia through Schedule 6 injectable steroids with educational requirements and certification requirements. We got here not through lawyers negotiating like us, but through the clinicians sitting down and talking about what do you really need to treat these conditions. And we discovered that really the focus is less on injectables for styes, but more for chalasia. So we've narrowed this down, not in any sort of legal or political negotiation, but through a clinical analysis of what is necessary for the patient, which is exactly the way these things should work. So with that, I want to introduce some of the physicians that were involved to put a little color around what the substituting concept is. And we would hope that the committee would endorse the concept, and we would bring the exact language back to you. Thank you.
Okay, John, thank you very much.
Thank you.
Welcome.
Mr. Chair, Senators, my name is Dr. Walt Whitley, and I'm here presenting the Virginia Optometric Association. I do reiterate things that Cal just mentioned to you. We did speak together in over there, and we talked about clinically what can we do to address this. And so the surgery was taken out. It will be for injections for chalasia, Schedule 6 steroids. There is training that has to be equivalent to optometry school, which was SCO, which has all of these courses in there, as well as after taking the course, submitting completion of paperwork to the board. And so that is what we agreed upon, and thank you all very much.
Doctor, thank you for coming. Others, John, if you'd like to speak briefly? Okay.
I'm John Garrett. That's Cal.
Good morning. I'm Dr. Suzanne
It's taken me all
Everhart.
morning to figure that out, but I apologize.
They're very tricky, those two. I'm Dr. Suzanne Everhart, an ophthalmologist residing in Henrico and practicing in Hanover. And we had a very frank discussion this morning. This bill was going to give optometrists the ability to perform surgeries without having gone to medical school. We were absolutely opposed to that. They then came back, they amended the bill, and they said, okay, we just want to do injections. Well, injections can be very dangerous. And they wanted to inject into the subconjunctival space and the dangers that presents to the population at large and the need for them to have that privilege and for it to be legislated instead of them having that learned by going to proper medical school was not acceptable. This morning, at the last minute, we had the opportunity to sit down and discuss with them exactly what it is that they see in their clinical practice that they have a need to treat. As far as ophthalmology is concerned, with proper training that's been defined, we've agreed that they can use only steroids, only to inject into the lesion, and we will not permit or accept any incision or surgical procedures for the treatment of these lesions. So we agree, and we would like to know if you have any other questions for us today.
Doctor, we're so grateful you came. Thank you for coming today. If there's no questions right now, we will hear from anyone else that would like to say something in favor of this. Bruce and your guys, where do you guys stand today?
Mr. Whitehead and I, in arms, just want to assure members of this committee that we're kumbaya, and thank everybody for their patience. Get a picture, please. But I reminded my Spiders one last night. Randolph-Macon didn't make it on TV.
Thank you. Mr. Keeney, we appreciate that. And let me just say, anyone else need to speak from the audience? If not, we are grateful. I don't know where the representative from MSV is, but thank you for your work this morning, Scott, and the whole group. We're grateful for you. There is if we could have council report in concept what the amendment will look like. And then we'll talk. David, would you like to have something else?
I don't want to suggest a suggested approach, but I wanted to make sure everyone heard where we were on the testimony. I don't agree with everything that was said. I believe that the approach that we were talking about, that 18 other states would be is good, but in the interest of advancing patient care, I think this is a good approach for today. And I hope we will report the bill. The language, making sure every I is dotted and T is crossed. I would suggest if anyone has any questions on it, and then make sure that we have, council has the actual language.
So, David, I don't, these things go cattywampus if you don't get them nailed down. So my
It will
hope,
happen, yeah.
my hope is that what we will do, if you're okay with this, you've done so much work, we're grateful, but if you're okay, I think we will fix the language in the next hour or so.
Yes.
And then before we leave, everyone will see the language, but we're going to vote today. Is that okay with you, sir?
That's exactly what I was going to suggest. You said it quicker than I did, though. Thank you.
One of us had a great mind. It's you. So, all right, Senator Carrico.
Just a one question for somebody that's been kind of back and forth on this and having talked to my optometrist in my area. Is what your agreement came up with, that you came up with, is it in concert to what dual states do? In other words, I have optometrists that practice in Kentucky and in Virginia, or Tennessee and Virginia. How does this legislation compare to what they're able to do in other?
Putting a positive spin on it, Mr. Senator, Mr. Chairman, it is a step forward. It is not to the same level of care that is provided in those states.
Okay.
Perfect. And Mr. Keeney, thank you for the work. I know you had another bill, but this is a step forward for affordability and for health care. And we try our best to stay out of kind of the inner fights, but we are all interested in outcomes and education, right? And that's what you guys have discussed, and that's the compromise we have before us. Mr. Sudalan, do you mind if we just let this go by temporarily now? You will help work on a substitute. Tom, maybe you can get someone in Legislative Services to help them out a little bit, although your expertise will be needed here. And we will get a substitute drafted as we move forward. Mr. Sudalan, thank you for that. Yep. Next up, do we have all the representatives? And if those of you that are optometrists, ophthalmologists would like to stay, we're always delighted to have you stay. We're going to talk about a lot of other things, and I know that there are a lot of people that would like to get in, but it's up to you guys to decide. But we probably could use a couple of seats for some of those that are in the audience to talk about some of the other matters. So. With that, up next, we're going to have a discussion about the Medicaid bills. And by agreement on these bills, we're going to hear from each one of the patrons. And Hobie, I hope you have all the patrons are either here or soon to get here. Then we're going to hear from Senator Donovan about her bills. Her bills are not before us right now, but we are going to hear from you, Senator Donovan, about the package of bills that you have as well. We'll talk about those items. And then we're going to give each side about 20 minutes by agreement with both the Republicans and Democrats. We're going to have about 20 minutes discussion. And then we're going to have a vote as we roll the bills together. As we roll the bills together, we're going to have a vote on those bills. And the options are that they can either go to finance, they can be passed out, or they will be passed by indefinitely. If you don't mind me saying this to those of you that are interested in the Medicaid issue, this is round one, and there will be at least 9 rounds, right? So whatever happens today will not be the end of or the beginning of this. There will be some bills that will be in finance. There'll be some bills that will be in the House of Delegates. There will be there'll be some items in the budget in both sides, so there will be items on all sides. So with that, which of the patrons do we have here for the Medicaid expansion bills? We have Senator Barker. We have Senator Edwards. We have Senator Donovan is here. We have Senator Edwards. Do we have Senator Hanger? All right, so we will hopefully get Senator Hanger in as well. So, right, got it. So Senator Hanger, Senator, and to all of you, just to restate briefly, we're going to hear from all the bills. We're going to roll the bills together into the broader of the bills, and we're going to take a vote on those bills after setting a clock of about 20 minutes by agreement of the committee. Senator Hanger, I know you've got as busy of a schedule as anybody I know. Would you like to go first and describe your bill? And then we'll hear from Senator Barker, then we'll hear from Senator Edwards, and then we'll hear from Senator Donovan. Mr. Chairman, welcome.
Thank you, Mr. Chairman, members of the committee. Appreciate the courtesies that are being extended this morning for the hearing on this important subject. Not a new subject for us, and obviously one that there's a bit of tension in the air about it this year in terms of what we may or may not do. And I want to thank all of those that are introducing different measures to try to deal with this issue. Mr. Chairman, members of the committee, y'all have struggled with this in the past, and I just kind of want to set the table with just certain bullet points. First thing I want to point out, Mr. Chairman, is that I'm a Republican, and I want people to notice that I'm a Republican. Okay, so this is what I'm presenting to you is what I view is a very what should be a very bipartisan bill that, as I've vetted it through the community, certainly back home and with stakeholders, I have discovered that there is a broad base of support for a common sense solution to where we're at now with the remnants of the Affordable Care Act. Just a bit of background. As you may recall, I was involved with this a number of years ago when we basically opted to say, hey, we don't have agreement between the principal players, between the House and the Senate and the administration. In fact, the administration at the time was Governor McDonnell. And so we decided to establish a Medicaid Innovation and Reform Commission, which I chaired. We had a lot of information shared, and we came up with a list, Mr. Chairman, of reforms that we wanted to see in Medicaid. Well, and the outcome of that was we had decided, okay, if we accomplish all of these reforms in our Medicaid delivery system, okay, we're going to go ahead and apply for the enhanced match in federal funds because we feel that our system has been modified to the point that we feel comfortable that we can go ahead and access those additional dollars. A couple things happened along the way. We actually, I think, put in place, working with the administration and the Secretary of Health and Human Resources, Secretary Hazelwood at the time, and the Director of DMAS, Cindy Jones, I think we did a great job in accomplishing our task of reforming Medicaid. That's not to suggest that there aren't additional things that we need to do, but we accomplished that. Along the way, we had hearings. There are two very notable things that occurred during those hearings that stick out in my mind. One was when over 700 people were bussed in to listen to our hearings and engage in the debate, some of them were fairly aggressive. And so during the course of that whole day, I had a member of the Capitol Police assigned to me so that I wouldn't be subjected to bodily harm. So it was a very intense debate, okay? The other thing that really sticks out in my mind, Mr. Chairman, is some of the testimony. And one of the most poignant testimonies that I heard during that whole period of time was a young lady, perhaps in her 30s, who had a professional position. And as she appeared in front of us, she was hairless because she was receiving treatments for cancer. She had an upper-level management job. She had health insurance provided from her company. She got unhealthy because of her cancer treatments. She lost her job. She lost her health insurance and had no means of accessing health care other than just showing up and having some other means of people covering that bill for her. She made a very poignant story there that sticks in my mind to this day. So some of us established, and it was a bipartisan effort because quite frankly, the Democrat majority at that time deferred to 3 members of the Republicans in terms of putting forth a plan which we call Marketplace Virginia. We got hung up along the way on that, as you're aware, and we didn't quite get there. Over the last several years, it appears that there just was not a consensus to move forward, so I basically let it drop. But here's the advent of the Trump administration with the pledge that the Affordable Care Act was going to go away. Well, we all know, and we set up a joint commission, which I've worked with Delegate Jones, Chairman Jones, that we have been monitoring what the feds have been up to. And what they did was they didn't repeal the Affordable Care Act. Most notably, they didn't repeal the taxes, the significant taxes that support the affordable care system. So what we have now, Virginia taxpayers are paying into a system and receiving only a portion of the benefit that's accruing back. That really is my primary motivation for being here today, in that I think we need to access the enhanced funds that are available to us that Virginians are currently paying. The bill, my starting point as a Republican is basically to X out the initiative that was in the budget that was put there by Governor McAuliffe. Why did I do that? I think there's been a lot of political tension, and I certainly think Governor McAuliffe had good intentions with his attitudes toward pushing, but was at a time where we didn't have a solution on the table, and we were concerned about where the program was headed. So that's the starting point, and here's the bill, Mr. Chairman. I'll go quickly through the bill because you have a number of people to hear from. First, the bill mostly is contained in an enactment clause. There's one provision that's earlier in the bill on page 7, item 26, and that is the provision with the language there that would increase those eligible throughout the Commonwealth, regardless of their status, whether they're married, have dependent children, whether they're older or what, to 138% of the poverty level. That's on page 7. With the rest of it, we skip to the back of the bill. And here's basically what has been worked out so far. And Mr. Chairman, I would say, even though you have a bill in front of you today that you're going to be pressured to act on, I hope you can keep a bill alive that can serve as a vehicle for us to work with, particularly as we develop the budget. On the enactment clause, enactment 2, that 30-347 is the Merck Commission, which this language would repeal that commission. And then into the heart of this is a two-pronged effort, Mr. Chairman, at putting something on the table that could have bipartisan support. The first element, which is contained in enactment clause 3, would be a proposed amendment to our state health plan, and to our Medicaid plan, to the state plan. And what that would do, would be basically provide almost immediate, as quickly as we can get it on the ground, additional dollars for the Medicaid system for this new population that we're covering. The governor's proposal had a target date of October the 1st. My proposal was a little more aggressive than that. I see no reason why we shouldn't at least attempt, and I talked to our new director of Medicaid just yesterday, attempt to put it in place by July 1. Now, what does that do? That actually helps our numbers a little bit, because you'll see, Mr. Chairman, I'm not proposing the provider assessment within this particular measure that is in front of us. What that means with implications for the budget, there's a $421 million swing, Mr. Chairman, depending on what we do. $420 million that falls to the bottom line if we were to go forward October 1st with the accessing the enhanced federal dollars, a combination of provider assessments and savings to our expenditures of $421 million. The provider assessment itself over the biennium is $307 million. The savings from actually putting these in place is $114 million. By moving it to July 1st, we can essentially save an additional $64 million in the general fund, something that I'm very sensitive to as we're trying to put our budget together right now, and draw down an additional $360 million in non-general funds. So let me quickly go through what this proposal would do, and I feel comfortable at this point in time with talking to a lot of people that we can do this with a simple amendment to the state plan. It has requirements to increase personal responsibility of recipients for health care, including a schedule of co-payments that includes incentives for primary care and appropriate treatment of chronic conditions, and discourages non-emergency use of hospital emergency departments. Secondly, requirement that benefits provide population closely aligns with commercial health insurance plans. Third, and this is on page 11, the enactment clause, incentives for preventive care, including initial primary visits, wellness activities, healthy behaviors, and job readiness activities. Incentives, only incentives. I thought I read that some people didn't like this because we require people to go to work, but it's just incentives to encourage employment for individuals who are unemployed. We've got to recognize some of the states that have expanded have found that up to 50% of the people that are not working have mental health issues, substance abuse issues, chronic illnesses that they just can't work. So if they're unemployed, not attending school, and you can read the rest of that. Options for payment of premiums, access available employer-sponsored health care coverage in lieu of coverage through the Commonwealth's program of medical assistance. I think that's an important provision. Protections for the Commonwealth in the event the federal financial participation is reduced below the amounts that are currently scheduled, 94% now going down to 90%. Provisions for quality care measures for healthcare providers providing services. Strengthen efforts to detect and punish fraud and abuse. Special provisions for individuals with mental illness, including substance use disorders, which shall include same-day access to behavioral health services at community service boards, and diversion plans to get people into treatment rather than incarceration, which will ultimately save us significantly more money. Mr. Chairman, those provisions are included in a proposed amendment to the state health plan, which could be implemented almost immediately.
Mr. Chairman, do you mind if we move the substitute so that can be before us, sir?
Yes, that would be great. This is embodied in the substitute.
Yes, sir.
Mr. Chairman,
Yes,
I do have a substitute.
the motion is seconded. Substitute to Senate Bill 572 be adopted. All those in favor say aye. Opposed, no. It's before us. Yes, sir. Go ahead.
Thank you, Mr. Chairman, and I'll try to be as brief as I can. The fourth enactment clause in the substitute directs the Secretary of Health and Human Services to convene a work group, and it details in there, and that's something we can work on if you want a different composition there, to work basically on a waiver proposal that would be concurrent. We would access the funds, but then at the same time we would work on a waiver that might include a work requirement for able-bodied adult recipients of medical services, provide for periodic verification of household income for an individual subject to the work requirement, and for redetermination of the individual's eligibility, and impose certain requirements related to cost sharing for recipients of medical assistance services, including premium, co-payments, co-insurance, provide incentives for healthy behaviors, and provide premium subsidies to allow individuals, and this is an important provision, to individuals whose household incomes exceed 100% of the poverty level to perhaps to help them enroll in private insurance in the federal health exchange market. The requirement that would be that this plan be worked on immediately, that the application be made as soon as possible and report back to us by December 1st of this year. A further provision, and this gives us a 2-year window, because quite frankly, Mr. Chairman, those of you who have been monitoring understand that one of the areas that we need to be concerned about is where Congress is seemingly wanting to go with this. They're seemingly want to go with some form of block grant, which in large part is calculated by the current amount of monies that a particular state is receiving through their program. So I'm building into this a 2-year window for us to receive this waiver, and then if the waiver is not received in 2 years, then certain provisions of this then would become obsolete. There's a 2-year window there. Mr. Chairman, that is essentially it, although there are additional features that I think as we work it through the process, we could cause it to happen. I am hopeful that even those of you who have some discomfort with this at this point in time would be willing to at least help me get a vehicle into the Finance Committee that we can continue to work on. I think it's important for us to have a bill to work with in addition to the budget, so more people are involved with the process. Thank you, Mr. Chairman.
Okay. Senator, thank you for your presentation. The chairman of the Finance Committee's worked long on this. In particular, I haven't seen all the provisions that were in this bill until the substitute I got today, and a number of them do make leaps toward trying to insert some accountability. Grateful for that. Mr. Chairman, if you don't mind, what we're going to do is we're going to hear from the other patrons. Next up, Senator Barker. And Ms. Secretary, I'm delighted they let you in, and glad to have you here. If you don't mind, after we hear from the patrons, we have agreed to let you have just a moment to talk kind of a global view on this, and then we'll go to those 20 minutes and move forward. So, Senator Barker, thank you. And we know you've been working on this for a long time, along with Senator Edwards and Senator Donovan. The highest concentration, I think, Senator, would be on the differences between the bills, but we'll look forward to your presentation. Thank you, sir.
Sure. Thank you very much, Mr. Chair and members of the committee. My bill is actually a very simple and straightforward bill, and that what it does is it would have us go forward as quickly as we can with an amendment to the state plan to implement it. That state plan amendment is part of Senator Hanger's proposal there, and is could have the same types of provisions built into it that he alluded to in terms of his proposal there.
So this is Senate Bill 282.
282, yes.
And then we'll take up 158 and also 956.
Yeah. So that, that's essentially what my bill does. My bill does not have the provision in there that Senator Hanger incorporated for the moving forward with the 1115 waiver, but I'm in no means opposed to that. I think that is a reasonable step to take so that we can take a two-step process to move this forward and implement things.
Senator, are you generally okay with all the other provisions that are in Senator Hanger's bill, some of the work requirements and some of the other items?
Yeah, I think all those types of things are things that should be on the table, and I don't have any problem with that. The one caution I would have to Senator Hanger's bill is the date of July 1, 2020 being in there. I'm happy with us putting requirements on ourselves to do things. Have a little trepidation to basically saying we're going to pull the plug on everything if the federal government doesn't respond, because we don't have any ability to control that process. I think it's important to have something in there to address this and make sure that we're doing everything we need to do. But I do have some trepidation with that particular date.
Perfect. Senator, I wonder if you would not mind giving us the information about 956 while you're there, just so we have the subject matters that are in this area as well, and then we'll look to Senator Edwards.
Yes, Mr. Chairman, 956 is a bill to establish the provider assessment authorization there. That has been incorporated. It was listed in a budget there. I think it's advantageous to us and to the whole system to have something like that be addressed in a bill rather than a budget. One of the concerns that I have, and that many of the hospitals and health insurers and others have, is that if we were to do it solely through the budget, that could readily be changed in a future budget to require additional contributions or to use some of the contributions for purposes other than what's intended. So what my effort here is to create an authority that would be able to put strictures around that so that the assessments could be done only for the purposes for which are intended, which is to support this particular program and not anything else.
Senator,
there are a lot of issues with that proposal that's there, and I guarantee you if we end up doing this, it will look very different in the end from what was submitted. I had no time to really revise this before having to submit the bill to meet the deadline.
So Senator, just to make sure on that bill, there are no amendments. The percentages that were there before are the percentages that remain in that bill. Is that correct?
Yeah, there's no amendment now, because my sense was that what we need to do is first make the decision as to whether we're going to go forward with expansion, and if so, are we going to explore doing the assessment. And at that point, I think would be the time to sit down and resolve the assessment piece of it.
Well, George, thank you for your work, as always. Just well done. Anything else that we need to know about your two bills before we go to Senator Edwards?
No, I don't think there's anything else about my bills. I mean, I always say at some point I'll be happy to make any comments on how we think we should proceed.
That's a good idea. Okay, thank you. Senator Edwards, you want to talk about your bill, and in particular, sir, if you don't mind talking about the differences between your bill and the bills that are currently presented. It looks like yours is very similar to Senator Barker's bill, but if you'd help us understand that, sir.
Well, Mr. Chairman, members of the committee, what this did, you've seen it before, Senate Bill 158. It has to do with providing Medigap insurance in Virginia for people who are under 65. Medigap is available for people over 65 and on Medicare. But if you're under 65 and you're on Medicare because of you're on SSI, and it's and you're sicker, then you ironically cannot get Medigap insurance in Virginia. There are 33 states that do provide Medigap insurance for people under 65. The states, the insurance companies won't do it on their own, however, because the people under 65, by definition, are sicker. They're more disabled, and the insurance is therefore more costly. And therefore, we need a bill like this to encourage insurance companies to provide Medigap insurance for those under 65 and are on SSI. Now, the experience from Colorado, Maine, Tennessee, and in Northern Virginia, where they do have Medigap insurance, the experience is that the system can work. There is a market for Medigap insurance that is affordable in these places. But again, the insurance companies won't do it. The logical reason is they don't make any money on this because people under 65 who are also on Medicare are on it because of their particular wellness situation, which is not good. So therefore, I think we need something like this in order to encourage the insurance companies to provide, just to offer Medigap insurance. And otherwise, again, it's really ironic that people under 65 are on Medicare and because of their illness cannot get Medigap insurance and therefore can't afford many of the medicines that are needed. Is that simple?
John, you're right. This bill is both a little different and also covers a very narrow gap that you have been advocating for a long time. We're very grateful that you brought this bill before us. Thank you for that. If you don't mind staying around for a little while, Mr. Secretary, we're delighted to have you here. And as we talked last night, we'll give you 3 to 5 minutes. You want to kind of express your overall thoughts on this bill, and we're delighted to have you.
Thank you very much, Mr. Chairman, for this opportunity, for giving a moment to speak to the general topic. I also want to thank all of you, particularly the patrons of the bills attempting to address expansion of health coverage that are up this morning, for advancing this important issue and giving it the careful consideration that it deserves. Governor Northam asked me to appear this morning to convey his position on expanding coverage and his commitment to working with members of both chambers and both parties to get this done in a way that works for everyone. Governor Northam supports the proposal in the introduced budget to expand Medicaid in the simplest and most expedient fashion possible. That plan will expand health coverage to nearly 400,000 Virginians, create thousands of new jobs, and save our budget more than $400 million. Expanding coverage will also significantly aid the Commonwealth's rural hospitals and bolster our efforts to combat addiction, the addiction epidemic, and improve our mental health system. That being said, the governor recognizes that members of the General Assembly have a range of ideas for how to expand coverage for Virginians. He is eager to have that conversation and work to structure a plan that gets Virginians access to care. We view this as the very beginning of the process this session and look forward to working with you and your colleagues in the House to find a way forward on an issue that is so important to Virginian families, our hospitals, our economy, and our budget. Thank you, Mr. Chairman, for this
Secretary,
opportunity.
we're delighted to have you here on these few bills. Are there any questions for our Secretary at this time? If not, Mr. Secretary, thank you. You're always welcome to be here. We appreciate you joining us today.
Thank you so much.
All right, Senator Donovan, and this is just subject matter. Senator Donovan has a number of bills that are on the same subject matter that I wanted her to discuss in global terms, and so that you know we could not get them printed and on the docket for today, and I apologize to you, Senator, for not being able to do that given their introduction dates, but I wanted to hear from you, and then we'll move forward from there.
Thank you so much, Mr. Chairman. I think this is, it's really exciting to be in the midst of a conversation about how we solve some of these problems. And I think this is what we've been asked to do. So as I come to the table today, I appreciate your indulgence to let me talk about the bigger scope of what I'm looking at, because I think that healthcare and the challenges we have are something that we have to solve in more arenas than just Medicaid. And so as I take care of patients, and to be clear, I have patients that can't get to primary care as holders of insurance because their deductibles are so high they can't afford to go to the doctors. This problem is across the marketplace. We also, I've been a participant in Access Now, which is a program that is donated tens of millions of dollars to take care of people without health care insurance. And I think that we can move much closer to doing something better for the state. First of all, we can't have this conversation without private market. We have to make health insurance less expensive for those that are purchasing it. And there are some bills that I'm introducing along those lines. I think we can do a little bit of a better job of guarding the dollars that we're spending in the state by transitioning our budgetary procedures in HHR to pay for success. But in contrast to the Medicaid proposals you've had this morning, I have something different. It's very reflective of what I've heard from my constituents, and that is specifically that they very much want to take care of people in their community that have complex illness, be it physical or mental, that have substance use disorder and have other challenges. But they are concerned about expanding Medicaid, as in fact Governor McAuliffe expressed in his statement to us when he gave us the budget about how these funding streams will be maintained. So to that end, I have, instead of changing the state plan, proposed that we change a waiver we already have in place that could be done immediately. It is currently the GAP waiver. I would propose that we change it to the Priority Needs Access Program. It would require some integral change of the program itself. It would have to go from fee-for-service to managed care, as does Medicaid. It would also include, in that case, inpatient and emergency services. We would actually increase the reimbursement to hospitals above the statutory rate to approximately 83 cents on the dollar. And we would look at meeting the needs of specific populations through Medicaid, expanding access to them, both for mental health illness, substance use disorder, life-threatening or complex disease. We would include in that alternative transportation, which is something we've been trying to solve for a while, and early childhood diagnosis and intervention for trauma, which helps us get out that pipeline to juvenile court, et cetera. Most importantly, I think that in contrast to the proposed budget that we have, a lot of the money that has been expanded or drawn down or saved in this process, 60% of that has not been used in healthcare. I'm very concerned about that money being shifted into our general fund responsibility in the future. And more importantly, I'm really concerned that we haven't funded the Priority 1 waivers. So my plan would also fund all of the 3,000 plus Priority 1 waiting list so that we would begin to get access to those people who we have assessed to have need immediately. So I know that's concise and kind of general, and I'm happy to take questions, but that's the basic idea.
All right, there are questions, Senator. Senator Donovan, again, I apologize that the committee could not get the bills together to have them before us today, but appreciate your continuing work. Just to let you know, if your bills were to pass, because they do require funding, there's about $300 million in there. Is that about right?
There would be $300 million in hospital contributions, right. Correct, provider fees.
Those that will have to go to finance if we end up taking up that bill next week. So good. Thank you, Senator Donovan.
Thank you.
So Senator Barker, Senator Edwards, Senator Hanger, and Senator Donovan. If you guys, if you have any questions to them, we'll take it. If not, what we're going to do is we're going to set a clock, and we're going to put a little different than some other times. We're going to actually take that to 20 minutes. I don't know that we will need the 20 minutes, but by a discussion within the group here, we're going to have the 20 minutes available, and we'll hear from those first that are supportive of the bill. So could we have some those that are in favor of that bill? Welcome.
Looks like I'm up first. Mr. Chairman, members of the committee, I'm Julie Dine with the Virginia Hospital and Healthcare Association. And let me first thank all of the patrons. Sincere appreciation to Senator Barker, Senator Edwards, Senator Hanger, and Senator Donovan for your efforts. This is a complicated issue, and we are thankful for the conversation. Today, like many of you, and many of you in this room, Virginians are struggling and fighting with the flu, runny noses, and painful coughs and irritating sneezing fits. Countless of Virginians who do not have access to health care find their only option to be the hospital emergency room. Since 2012, uncompensated care costs for Virginia hospitals have exceeded $1 billion a year. In 2016, Virginia hospitals had a total of $1.1 billion in uncompensated care. Increasing health care access is essential to responding to Virginians' everyday run-of-the-mill runny noses, to more serious of those health challenges such as behavioral health needs, the opioid epidemic, and chronic diseases. According to the U.S. Substance Abuse and Healthcare Services Administration, nearly 35% of the uninsured population with income below $16,643 had a mental illness or substance abuse disorder between 2010 and 2014. Making Medicaid available to individuals with income less than $16,643 a year, and let me repeat that and let me underscore, $16,643 a year is the income. For a family of three, the income eligibility is $28,180. This provides an affordable coverage option for those Virginians who are currently lacking any support to improve access to care, to confront and manage chronic conditions that are preventing economic opportunity and driving up healthcare costs. Increasing access to healthcare coverage can prevent family illness or health problems from turning into bankruptcy, loss of home, and/or poverty. Accessing available funds will offset current state spending for prisoner care, community mental health services, and the GAP program. The net result in providing more comprehensive services to far more Virginians while freeing up $138 million in state resources. In closing, a majority of Virginians do support drawing down federal dollars to help the uninsured access health care. Increasing access to health care is a common sense approach that will improve health, support 15,000 new jobs throughout the Commonwealth, and help preserve Virginia's community hospitals and healthcare centers that so many of us depend on. Amending the state plan for Medicaid assistance is the simplest, most direct way to provide eligibility for adults and the opportunity to access health care.
Great. Thanks for coming. Welcome. Look forward to hearing from you. And just know that if you have written comments, you can give them. The 20 minutes is a pretty hard number, but if you want to submit your written comments, we'll take those as well. Thank you. Welcome.
Hi, my name is Donna Sywinski, and I'm a resident of Fauquier County. And it's the first time I've testified, so I'm a little nervous. But our son, Adam, is almost 30 years old. He was born without the right valve of his heart. And our insurance has taken care of him until he was 26. He can only work part-time. His twice yearly costs are $4,000 per visit. He has to be on Eliquis, which keeps him from having a pulmonary thrombosis or a stroke. And that costs $500 a month without insurance. And at this point in time, he doesn't make enough money to qualify. So if we don't have Medicaid expansion, what that means is my husband and I, who are ready to retire, are going to have to basically bankrupt ourselves to make sure that he can get medical care. We've worked hard all our lives, and our son is very important to us. So I thank you, and I ask you to please listen and please expand Medicaid for all.
Thank you for coming today. It's very kind of you to travel to us. Thank you. Yeah. Yes, sir. Welcome. Yes, sir.
Russell Javone with AARP Virginia, and we support this legislation.
Thank you for coming today. Yes, ma'am.
Mr. Chairman, my name is Lorraine Bratton, and I'm a volunteer with AARP and from Roanoke County. A lot of our members are over 50. They're not eligible for Medicare, and they're losing their jobs. And they can't get insurance. So Medicaid is a survival thing for a lot of our members, and we have 1.5 million members in Virginia. Thank you.
Thank you for coming from Roanoke County. Yes, welcome.
Good morning, Mr. Chairman, members of the committee. I'm Jill Hankin from the Virginia Poverty Law Center. I'm here on behalf of the Poverty Law Center, but also the Healthcare for All Virginians Coalition. We have over 111 organizations in Virginia who've come together over the past several years to support Medicaid expansion in Virginia. It's time now for Virginia to move forward to provide health insurance to nearly 400,000 low-income Virginians. It's time for us to bring the money back from Washington, D.C. to help us provide this coverage. It's time for us to provide Medicaid to hardworking parents. In Northern Virginia right now, if a family of 3 is earning more than $11,000 per year, the parents are ineligible for Medicaid. Under expansion, again, I'll repeat that, $11,000 a year for a family of 3, the parents are ineligible. If we expanded Medicaid, that same family, the parents could get coverage if the family income was up to $28,000 a year. Still not much, but much better than $11,000 a year. And for a single individual, someone who has 0 income right now, who's not disabled or elderly, can't get Medicaid at all, no matter how poor they are. And this would move the income level up to $16,643 a year. Still very poor individuals who don't have any other access to health care. It's time for the state to really take steps through Medicaid expansion to address Virginia's concerns about mental health and the opioid crisis. I really appreciate the patrons' work on this issue. Senator Hanger's been a leader in on this topic, and there are approaches available to us to finally get treatment to people who need it. So I hope that these bills will move forward to finance and we could continue these conversations during the rest of the session.
Great.
Thank you
Grateful
very
you're
much.
coming today. There's about 12 minutes left for those of you that are in favor of the bill. Welcome. Yes, ma'am. Thanks for coming today.
Good morning, Senators. My name is Monica Hutchinson, and I live in Henrico County. I am here today to support the Medicaid expansion bills because I am the mother of a 10-year-old autistic child. Right now in Virginia, I have insurance through my job as well. My commercial insurance does not take care of treatment and things of that nature for autism. That is covered under Medicaid. But unfortunately, because of the income restrictions, we don't qualify for Medicaid like other families can. Medicaid also helps pay for special education here in Virginia, helps to make sure that our teachers are properly trained, make sure that the schools have everything that they need for each child to succeed. And unfortunately, special education is inadequately funded, and we know that. Burdens do have to fall back onto local school districts, and and not all school districts are equal in that respect. So, like I said, I am the best voice and advocate for my child, and I'm here fighting for my child today to make sure that he's given every opportunity, just like every other child. I know some children may need more resources and more support services than others, but every child is worth it. So today, I really do ask that you guys truly take a look at this, expand Medicaid here in Virginia to make sure that all of our kids are given the same opportunity across the board. Thank you.
Thanks for coming today. Yes, ma'am. Welcome.
Good morning. My name is Jewel Farley. I'm here to ask you to support Medicaid expansion. We come talk to you about this for several years now. Medicaid expansion will help provide health care to 400,000 hardworking, low-income families. Medicaid expansion will also bring income back to Virginia. It is time to grow Virginia's economy again. It is time to have our tax dollars come back to Virginia once again. It is time to make sure that 400,000 Virginians have Medicaid expansion. Thank you.
Thank you for coming today. Yes, sir. Welcome.
My name is Charles Carter. I'm a two-tour Vietnam veteran. Since January the 1st of 2014, the state of Virginia has spent between $2 million to $5 million a day to other states that have Medicaid expansion. Why are we waiting and wasting Virginia's money that people here in this state needs medicine? The elderly, you have families that's working 2 jobs that cannot afford it. They cannot afford to take care of their children. But we put it in the hands of this committee to vote on what is right. We're not asking you to do anything that you would not demand yourself to be done for you and your family. Please find it in your heart to do it for the families of the people of Virginia. Bring Medicaid expansion to Virginia.
Okay. Thank you. Thank you for your service. Yes, ma'am. Welcome.
Hi, I'm Jessica Morenocaicho, and I am going to be reading my friend's testimony. My name is Alexandra Dixon with the Virginia Latina Advocacy Network, and I have lived in Virginia since I was 4. I am originally from Bogota, Colombia. I was born in 1982 with a disability called spina bifida. My parents and I came to the States because children with spina bifida were surviving in the States, which they were not in Colombia. During my childhood, my parents were able to afford and keep private health insurance that kept me alive. When I turned 18, I qualified for Medicaid, but it was hard to qualify and it was a long process. I was only on Medicaid for 3 years while I finished college. After college, I have been gainfully employed. The investment made in me while I was on Medicaid in college was worth it because it helped me become an independent adult. One of the jobs I had was as an ACA navigator in Maryland. I have seen firsthand the good that came from Medicaid expansion. Put simply, it is life-saving. I saw it save the life of a woman who, after she qualified for Medicaid, she went and got a mammogram. The mammogram found cancer and it was aggressive. Because she had Medicaid, she was able to get the treatment she needed to stay alive. I remember the woman with brain cancer because Medicaid expansion helped her. Access to medical care should not be dependent on where someone lives. As a Unitarian Universalist, I affirm that every life has inherent worth and dignity. Access to quality medical care is a human right. It makes financial sense and it makes moral sense. Therefore, I urge the committee to vote to expand Medicaid in Virginia. Thank you.
Thank you for coming today. If you do have some long statements you may want to, and they're written, you may want to give them here. Just make sure everyone gets to speak. Welcome.
Yes, good morning, Mr. Chairman, members of the committee. Robin Gann with the American Heart Association, and we, of course, are in support of all opportunities to increase health care access for Virginians. Thank you.
Thank you for coming today. Yes, ma'am. Welcome.
Good morning, Mr. Chair and members of the committee. My name is Julia Newton, and as a mother of a child that has severe autism, I cannot tell you in this short of time the hardship that having Medicaid expansion in Virginia, the hardship it has on families like me. So I'm here today to ask you to support Medicaid expansion for mothers like me and for children like my son. There was a time that I worked 3 jobs and I could not afford to go to the doctor, so I resorted in going to the emergency room, which it racked up a lot of bills. It also was hardship on my credit, and it's just a really hardship on the family to not have Medicaid expansion in Virginia. Thank you for your time.
Well, thank you for coming today. Yes, welcome.
Hi, you all look lovely. Mr. Chairman, members of the committee, my name is Brian Walsh, and I am here on behalf of the Virginia Interfaith Center for Public Policy, the oldest and largest interfaith organization in the Commonwealth, so most appropriately, blessings upon you. I am here today to say that the center stands in favor of expansion and drawing down those federal dollars, as well as getting coverage to those nearly 400,000 Virginians. Thank you.
Thanks for coming today. Yes, ma'am.
Mr. Chair and committee members, Jennifer Allen with Planned Parenthood Advocates of Virginia. On behalf of the thousands and thousands of low-income people that we serve across the Commonwealth who need not only reproductive health care but access to primary care too, we strongly urge you to pursue expanding Medicaid, and thank you for your time to hearing it today.
Yes, ma'am. Thank you for coming. Yes, ma'am. Welcome.
Thank you. Mr. Chairman, members of the committee, Felicia Preissner with the Virginia Catholic Conference. We support any measures that close the gap and expand Medicaid expansion. At its core, health care is for all, not a commodity within reach of some, but out of reach of others. Thank you.
Great. Yes, welcome.
Welcome. Mr. Chairman, members of the committee, my name is Stephanie Lynch. I proudly represent our Medicaid managed care plans, and we feel confident we are poised to increase access to coverage in whichever way the Commonwealth sees fit, and we look forward to continuing the conversation with you and your members. Thank you.
Great. Thank you for coming. Yes, sir. Welcome back.
Mr. Chairman, Scott Price, Alliance for Progressive Virginia. Wanted to let you know that when we poll our membership, expanding Medicaid is one of the most important topics, and it's something that matters very, very much in Virginia, and it's something we need to get done this year. Thank you.
Scott, thanks for coming. Yes, ma'am. Welcome.
Good morning, Mr. Chairman, members of the committee. I'm Dr. Karen Ruby, and I'm a pediatric cardiologist who cares for children and young adults with congenital and acquired heart disease. I also have the privilege of serving as the chair of the Board of Medical Assistance Services. Our board has repeatedly sent letters to members of the General Assembly supporting Medicaid expansion in the Commonwealth, and I'm delighted to have our team of Medicaid leaders here, and just encourage you to support Medicaid on behalf of all the citizens in the Commonwealth.
Great. Well, thank you very much, Doctor. Appreciate you coming. Yes, ma'am.
Good morning, and I won't take the 3 minutes and 58 seconds. Mr. Chair, members of the committee, Heidi Lawyer with the Virginia Board for People with Disabilities. We support Medicaid expansion and deeply appreciate the tireless efforts of all of the patrons who have worked on this.
Great. Thank you for coming. Yes, ma'am.
Hi, Chairman, committee members. I'm Jenny Halborn. I'm with the Disability Law Center of Virginia, Virginia's protection and advocacy agency for individuals with disabilities. We wanted to thank you for your work on this, and we support the bills for Medicaid expansion.
Well, thank you so much. Anyone else here to speak in favor of the bill? Seeing none, what we'll do is within the committee, are there questions to the patrons? If not, Mr. Chairman, why don't you just sum up real quick, and then we're going to have a motion maybe that will be supported that will roll some of the bills together, and then we're going to consider those bills. So, Mr. Chairman, if you'd like to just sum up, we'd love to hear back from you.
Thank you, Mr. Chairman. Certainly appreciate the courtesies of the committee with the expanded hearing this morning. What I'm hoping to accomplish today is to keep a vehicle alive to continue this conversation. I basically frame it in terms of accessing enhanced federal dollars. I think it's critical that we do that. We can do a tremendous amount of good, save a lot of lives. The priority this year for me is to direct funds to mental health, substance abuse. We've got a package of about $70 million in the budget currently, and it's very critical that we do something constructive. Otherwise, we're not going to be able to afford to do that. So thank you, Mr. Chairman, for your courtesies.
Okay, thank you. And it was pointed out to me that maybe I didn't get those that are in opposition. Those here that are in opposition to the bills, if you'd come forward and we'd hear from you briefly, and then we'll take it to the committee. Yes, ma'am, welcome.
Thank you. Lauren Toomey with Americans for Prosperity, Virginia. Medicaid is simply not cost effective. Researchers from MIT, Harvard, and Dartmouth found that Medicaid recipients only receive about 20 to 40 cents of benefit for every dollar spent on Medicaid. Insurance companies, not low-income citizens, are the biggest winners of Medicaid expansion. Kaiser Health News recently reported that Medicaid insurer profits more than tripled in 34 states and the District of Columbia after Obama's Medicaid expansion. We urge you on behalf of 100,000 activists in Virginia to vote against expanding Medicaid.
All right, very good. And then with that, Senator Barker, you want to kind of sum up on your bill?
Yes, Mr. Chair. I think the bill is a very straightforward bill. What I want to do is talk a little bit about what I think our responsibilities is in this particular situation and some of the factors that I think should push us in a direction of expanding Medicaid here. We all are responsible for doing what we think is best for Virginia and for Virginians. We also have a responsibility to listen to our constituents and to the people throughout the Commonwealth. A couple of years ago, the polls were showing that there was support for Medicaid expansion, but it was only by a relatively modest margin. There was not an overwhelming support for it, but the times have changed. Two recent polls showed very strong support for Medicaid expansion. One showed 60% of the public supporting Medicaid expansion, only 33% opposed. Another, where they talked specifically about the dollar figures, the upper threshold for income, showed even more support, with 60% supporting it strongly and another 23 supporting it, somewhat favoring the proposal, for a total of 83%. What's also important is that the gap between Democrats, independents, and Republicans on this has narrowed dramatically, and there are not the huge differences that there used to be. We've seen, since we've been down here a couple of weeks now, dramatic change in the composition of the House of Delegates, with 15 seats flipping, 12 incumbents being defeated, and one race ending in a tie. National issues clearly drove that, but the number one issue that exit polls identified in the elections this past year was health care. We need to be responsive to that public sentiment, with showing strong support now for Medicaid expansion. And I'm confident we will expand Medicaid, whether it's in 2018 or shortly thereafter, maybe 2020. I like all my colleagues in the Senate, both Democrats and Republicans. And if we do the right thing and listen to our constituents and expand it, more of us may come back in 2 years. So I hope we move in that direction. Thank you, Mr.
Senator
Chairman.
Barker, thank you very much. Senator Edwards do you have a couple of comments? Because I think that if this goes away, I think we may roll these together, including your subject matter. So any other wrap-up comments from you, sir?
No, just that the irony that people under 65 on Medicare, because they have SSI, cannot purchase Medigap insurance.
Yeah. Senator, thank you very much. Senator Donovan, you want to wrap up kind of your thoughts on this?
Mr. Chairman, I think that the one thing I wanted to touch on that I didn't have the chance to in the hopes of being brief when I spoke to you before is that there's another piece of legislation I have in that would look at a global waiver. And this is something I did want to address because we've had this conversation before. We have had information from Congress, as Chairman Hanger alluded to, that if they do actually block grant the states, that they will do it retroactively on a base rate that we have had in the past. And so I think that a conversation about a block grant or a global reform waiver that would supersede any of those cappings by the federal government so that Virginia could take some time to reform services as well and hopefully eventually do a better job caring for her citizens so that we could end up with a lower cost for both the federal government and the state is a conversation that we need to have after we get through this process because it would apply in either instance. So I'll just say that I have restricted my polls to my district. I've looked at my district. This is a plan that's reflected in the feedback that I've gotten. Provide care, be fiscally conservative, but don't expand really to healthy adults because it certainly changes the importance of welfare and Medicaid being a safety net for individuals into more of a nationalized health system. And that's the feedback I've gotten and why the plan I have is designed the way that it is.
Great. Are there others who'd like to speak on the committee? Yes, Senator Chase.
Thank you, Mr. Chairman. We've heard a lot of testimony today, and I would say it's safe to say that whether you're Republican or Democrat, these health care issues affect everybody. In fact, it's the #1 issue that Virginia is facing right now. And, the concern here is, how do we address those needs in such a way that it does what we really want it to do? And I have some concerns. I have people that come into my office, as well do my colleagues, of people with intellectual disabilities, people with children with severe developmental disabilities. And we should, and I have voted to support waivers to include those children. And I think we need to do more to help the children that have these issues and these needs. And we voted in favor of that. Many Republicans have voted in favor of that. My concern here that we need to be careful how we define Medicaid expansion because it means different things to different people. Medicaid expansion to some people means we're going to give health care insurance to everybody, even able-bodied individuals. And my concern with that is that we would end up diluting the help for those people who really need it. The one thing that's very different from the federal level, at the federal level, they can just raise the debt ceiling. We can't do that at the state level. We must balance our budget every year. And so if we've take a look at our state budget and the amount of money that the percentage of our budget that now goes to Medicaid, it's gone from 2% to 22%. If we expand Medicaid, what percentage of our budget is going to go to, and what is it going to crowd out? What other services, and do we, let's talk about education. I know many of us in this room want to make sure that we protect the education for our children. I'm a mom of 4, and I don't want to see cuts to education. What about transportation? I mean, it doesn't take long to know that we have major infrastructure needs. We have bridges in my district that you can't even drive ambulances over or fire trucks over because of the crumbling infrastructure. And I could go down the list. So we have a very important decision to make today That's not whether or not we care about people. It's a matter of limited resources and how do we carefully manage those resources to ensure that the resources are for the truly needy. And I'm concerned that we are putting at risk by expansion to able-bodied individuals. One thing that I think we need to do, I've introduced legislation that we have not discussed today called the Healthcare Transparency Cost legislation, and that is to shed light on the cost of healthcare, which is out of control. And I think everybody can agree on that. You can go to any other industry and you know what the cost is going to be for healthcare, except for healthcare. We need to have a no excuse mentality. Whether we expand Medicaid or not, unless we address the anchor issue here, which is the cost of healthcare, it's going to explode out of control. We have to get control over the healthcare in Virginia. And so I would encourage your legislators to support the bill that I put forward as well, the healthcare transparency costs, so that when you go to the doctor, instead of you just giving them, let's say if you have insurance, if you give them the insurance card, they typically tell you to sign on the dotted line that you have to pick up whatever cost your insurance company's not going to pay for, and you don't even know what the number is. And the doctors who want to give it to you, they can't even give it to you. That's unexcusable. We cannot continue down that path. We must expose the cost of health care.
Okay,
and those are my comments. Thank you.
Senator Chase, thank you for your comment. Senator Howe.
Thank you, Mr. Chairman. I wasn't planning to speak, but I think Senator Chase has it exactly backwards. By expanding Medicaid, we not only show mercy to Virginians and provide them health care, but if we're to look at it strictly from a financial point of view, we will benefit our state treasury. We will be able to bring back $423 million that we wouldn't have otherwise. It will cost the state nothing. The federal government would be paying between 90 and 94%, and we would have our hospitals pick up the difference. So the cost to the state would be zero, but the net benefit would be $423 million. And what would we do with that $423 million? We could put it into Medicaid waivers. I agree with her. That's an absolutely top priority. We could put it into education. We could put it into programs for people with opioid and other addictions. We could do a lot to help the people of Virginia, but if we keep refusing to accept this federal money, we have put ourselves in a box where we will suffer in Virginia as a result.
Thank you, Senator Howe. Senator Sasslaw.
Yeah, I would just say this, that Senator Chase mentioned the education. If we don't expand Medicaid, $421 million comes out of the general fund because that was in the introduced budget. And K through 12, I think, is about 30% of the general fund. Senator Hanger, correct me if I'm wrong, but I think it was came out to about 30%. So that would mean that if we don't pass Medicaid expansion, coming out of K through 12 is $120 million right off the top. And I can tell you as a businessman, if somebody came to me and said, Sasslaw, we'll pick up 90% of your medical insurance cost if you pay the other 10, and we think we have even a way around that 10, as Senator Howe mentioned, I'd have to be a lunatic to turn down that offer. And the point is that 31 states have expanded it. West Virginia, Kentucky, Tennessee, states, and Maryland, I don't think North Carolina has. So essentially all the states surrounding us have, including, southern states, border states, have done this. And it's just a big mistake for us to continue to buy into this. when you get some of the, virtually everybody in the medical profession, you got the hospitals coming in here, those people walk into that emergency room, and usually they come in when it costs a lot more to get them well, Mr. Chairman. And don't think that we're not paying for that. That shows up next year when you get your insurance bill, is that cost of them going into that emergency room. So make no mistake about it, we're paying for it.
Thanks, Senator Saslaw. Senator Black.
Just very briefly, Mr. Chairman, one of the problems that we've got, and I think everybody recognizes, is there is a degree of uncertainty at the federal level as to what's going to happen. Honestly, I honestly cannot predict for you what will happen. Will the program be done away with? Will it be entrenched? I just don't know. And I think really it is premature, regardless of what your views are. I think it's premature for us to move forward on this and potentially get ourselves stuck in a situation where we have expanded and all of a sudden we're having to do this thing on our own dime at enormous expense. We all know that the Medicaid program is perhaps the most fraud-ridden program that we've got in the federal government, and so the cost escalates. It's not all the fault of certainly of the states. To some extent, we've got just gargantuan problems with the way that we handle pharmaceuticals and the vast cost to those. But in any event, I just think that it is premature for us to take action when we just do not have any idea what the feds are going to do.
Great.
Mr.
Senator
Chair.
Yes, Senator Barker.
Yeah, just to address a couple issues that have been raised. The bill that I have, and I think the other bills, have a provision in there that says if the federal government changes the percentages, we pull out.
Got it.
So that is built in there. So our plan would go away if the federal government ever changed the percentages, which right now is a 90-10 shift. Right. So it's not something that we will be left holding the bag. We have addressed that very directly here. In addition, I would say that the Medicaid program is by no means fraud-ridden. We have an extraordinarily strong program in Virginia. It's regarded as one of the best Medicaid and one of the best Medicaid programs in the entire country, one of the best managed, and one of the ones that really does not have any significant fraud issue. Okay. So I think those are mischaracterizations, of the program that we have.
Senator Barker, thank you very much. Senator Chase, we're going to.
Thank you, Mr. Chairman. I'm just going to make a couple final points here. Number one, I would say that coverage does not necessarily equal care. I can't tell you the number of my constituents who are on the Affordable Health Care Act, and they are paying incredibly high premiums, but they still don't go to the doctor, just like Senator Donovan said, because they have to pay so much out of pocket. It's not affordable, and yet we want to expand it. I want to point this to you. Medicaid actually, according to the Galen Institute, they have a report here, and you can refer to it later, it actually harms the poor. The Medicaid program is so badly broken that it actually harms the people that it's intended to serve, and there are mountains of literature. I know we talked about the University of Virginia, what a great institution that it is, and I agree with that, but the largest such study by far was conducted by surgeons at the University of Virginia. They examined the outcomes for 893,658 individuals undergoing major surgical operations from 2003 until 2007, and listen what they found out. It found that patients on Medicaid were 97% more likely to die in the hospital after surgery than those with private insurance, even when adjusting for age, gender, income, region, and health status. Medicaid patients were 13% more likely to die than those who are uninsured. And that's because, listen to why, the Medicaid program pays doctors and hospitals far less than private insurers do, leading more doctors to drop out of the program entirely. In 2008, the Virginia Medicaid program paid doctors 29% less than private insurers did. In states with expansive Medicaid programs like California and New York, Medicaid pays doctors 62 to 71% respectively. When Medicaid patients can't get predictable access to care from physicians, their cancers go undiagnosed, their heart conditions go unmanaged. Virginia should instead insist that Washington and other states provide more flexibility with Medicaid spending so that the Commonwealth can provide them the dignity of private insurance. We need to look at private insurance and taking these block grants instead of expanding a system that is already broken and does not provide health care. Thank you, Mr. Chairman.
Great. Any other comments? If not, Mr. Chairman, you good? Or you want to say something?
I won't impose. You've been very courteous. It seems like we almost were skewing off the track here a little bit with some things that I could rebut, but I won't at this point in time. The Medicaid population, the low-income people, do die more frequently in the hospital because they haven't had preventive care, and they come in with extremely unmanageable cases. Yeah, thank you. And I apologize. Thank you.
All right, great. With that, there's a motion to roll Senate Bill 158, 282, and 956 into the chairman's 572.
Second.
There's a motion and a second that we roll those bills into the one bill. All those in favor will say aye. Aye. Opposed, no, and those are rolled in. So that includes Senator Edwards, Barker, and into the Hanger bill. Is there a motion on the rolled-in bills? There's a motion that the bill be reported. Very good. And any discussion on that? Just briefly, yeah, if it passes. So the motion is to report and refer to finance. And I'll be very, very brief. Guys, we're going to look at these bills. We're going to look at the Donovan bills next week. Senate Finance has some bills. I know the House Appropriations is thinking about another set of bills. So we are entering round one, and I know the governor is very much involved as well. So those of you in the audience will have multiple opportunities to kind of find our way to get there. With that, unless there's other discussion, the clerk will open the roll on reporting Senate Bill 572. Clerk, close the roll.
Yeas 7, nays 8.
And so yeas 7, and nays 8, and the bill fails to report. There's a motion to PBI, just so we can structurally get there. It's a motion and a second to PBI the bill. All those in favor of PBI and the bill will record their votes aye. Opposed, no. The clerk open the roll. Clerk, close the roll. 8-7. The bill is PBI at 8-7. Thank you very much. And Mr. Chairman, and to Senator Edwards, Senator Barker, we appreciate your help. Senator Hanger, you have another bill, I think, before us. Is that right, sir?
Mr. Chairman, I had some bills that had come through subcommittee. I'm not sure what may be lingering still.
Your staff had contacted me about bills, but you are correct. They are in subcommittee. So we'll take care of those. I think they're all in good shape.
Okay. Thank you very much, Mr. Chairman.
Very good. With that, Senator Obenchain is here or not here. Next up, what we're going to do is we're going to go to the Public Education Subcommittee, and we'll wait for some of these guys to get here. I think we can get through that relatively quickly. Senator Carrico.
Thank you, Mr. Chairman. Mr. Chairman, members of the committee, subcommittee has several bills that we took up. First is Senator Cosgrove's bill dealing with driver programs. Currently in Planning District 8, there's a requirement of 90 minutes of parent, student, driver training, and this would take it off the Planning District 8 region and make it statewide. And it was recommended that, or I'll move the substitute.
There's a motion and a second that substitute to Senate Bill 126 be agreed to. All those in favor will say aye. Opposed, no, and that's agreed to.
It was recommended that we report the substitute on a 5-0 vote, and that's so moved.
All right, so there's a motion and a second that that bill be reported as amended. All those in favor will record your vote aye. Those opposed, no. Senator's ready to vote, and the clerk will close the roll.
Yeas 14, nays 0.
14-0, the bill is agreed to. Do you want to take up 169 now, or wait just a little bit on
Let's
that?
wait,
All
because
right.
we didn't have a recommendation on that.
Go ahead to 205.
205 was dealing with the Child Services Act for special education, expanded the eligibilities of service under that act, and it was recommended that we report and refer this to finance, and I would so move.
Motion and a second that Senate Bill 205 be reported and re-referred to finance. All those in favor will record their votes aye. Those opposed, no. Clerk, close the roll. 14-0, the bill is reported. Senator Carrico.
Next was Senator Hanger's bill, Senate Bill 229. This is school bus personnel's training. There is a substitute to that bill, and I would move that substitute.
Motion is a substitute be agreed to. All those in favor will say aye. Opposed, no, and substitute's agreed to.
And this bill was requiring a Board of Education to establish a training program for school board employees who assist in transportation of students with disabilities, autism spectrum disorders, characteristics of autism, and it was reported from the committee with a substitute, recommended to report, and I'd so move.
There's a motion and a second that Senate Bill 229 be reported with a substitute. All those in favor will vote aye. Those opposed, no. The clerk will close the roll.
Next, Mr.
Ayes 15, no 0. Senator Carrico.
Next was Senator Peterson's bill that includes recreational time in the instructional time, authorizes the school boards to include, and requires Board of Education to accept for grades 1 through 6 uninstructed recreational time. There was an amendment. If
All right. The clerk will report the line amendment.
Thank you, Mr. Chairman. Senator Carrico. On line 10, after 4, strike grades 1 through 6, insert elementary school.
And I would move that amendment.
This motion is second that the line amendment be agreed to. All those in favor will say aye.
Aye.
Those no, and the line amendment is agreed. Senator Carrico.
And there was a recommendation of the committee to report, and I think there's some mothers here, if you want to recognize them, that traveled down here today.
Senator Peterson.
Mr. Chair, if I might, and I don't want to slow down a speeding train, but I have a great group of mothers came down from Fairfax County. If they could be recognized, I'd really
If
appreciate
you just
that.
stand, we're delighted you came down. Looks like you've put this on the gravy train, so it's moving along. Very good. Thank you for coming. There's a motion and a second that the bill be reported. This is Senator Peterson's 273. All those in favor will record their votes aye. Those opposed, no. And the clerk will close the roll.
Yeas 14, nays 0.
14-0,
the bill is agreed to. Senator Carrico.
Record me an aye on that last
Okay.
one. I
Sorry about that.
didn't hit the button quick enough. Skipping over Senate Bill 303, I think the patron needs to be here. That didn't come out exactly on a 5-0 vote, but he was here earlier. Senate Bill 343, Senator Peak, I think they're working on some language on that one, so.
Senator Peak, are you done? Well, we're not going to present. Are you done? Totally done? Is there an amendment to report? All right, so the clerk will hand out substitute. Tell us briefly what the substitute does. Is there a motion on the substitute? Motion is second that the substitute to Senate Bill 343 be agreed to. All those in favor will say aye. Opposed, no. Senator Peak, what did your sub? No, right there. What's your substitute do?
We just cleaned up Mr. Chairman, we just cleaned up the language on this so it would read better. The substance of this bill is there's a Supreme Court case that came out this summer, and it said no school board could have anyone who had been convicted of a felony, even though that person had been working. And what we have done in this statute is we are allowing school boards to hire people who have been convicted of a felony, have had their rights restored by the governor. The felony is more than 5 years old, and it excludes anyone from employment who has any kind of sexual offender, child offender, all the same safeguards that have been in the prior bills. This was requested by the school boards. It applies to janitors, it applies to bus drivers, it applies to everyone. And so we've had some situations where people with a bad check 20 years ago are barred from being an employee of a school board. So this makes it easier to hopefully ease the teacher shortage and the employment shortage and help people who have turned their lives around get employed.
Okay, Senator Obenchain, we're going to roll in your bill, but Senator, we are going to have a motion to report and then re-refer to courts because there's a couple things that I'm unsure about whether we should be dealing with. Is that okay with you, sir?
That's fine with me. And in fact, could I put a fine point on this, and I'll do it real briefly? Sure. These people who are covered by this Supreme Court case that Senator Peake and I are trying to address, I mean, are not the bad actors. These are people who told the school board about their youthful indiscretions, may have been hired as a janitor. I'll give you one example. 18-year-old in Shenandoah County was in a car crash when he was 18. His best friend died in that crash. He was prosecuted and convicted of involuntary manslaughter. He served his time, paid his price, paid the dues, was released, went to college, got his teaching certificate, applied for a job, told the Shenandoah County school system that what had happened, was hired as a teacher, became head football coach, athletic director, beloved, taught in the schools for 20 years, or nearly 20 years. And when this Supreme Court decision came out, school board fired him. School board fired him. Said, we can't continue to employ you. So this rectifies that. This is not trying to fundamentally change things. We want to keep people out who shouldn't be there, but this is wrong.
Mark, we appreciate your help on this. I think we're in good shape. There's a motion that Senator Obenchain's bill be rolled into Senator Peake's bill. All in favor of that will record their votes aye. Those opposed, no. Clerk, close the roll.
We'll work it out.
Ayes 15, no 0. Senator Carrico on a motion to report and re-refer to courts.
Mr. Chairman?
Okay.
Mr. Chairman?
Yes, Senator.
Just a very quick question. I
Yes.
don't normally ask questions from subcommittee reports, but Senator Peake, how does this gel with the ban the box legislation that comes about?
Well, the ban the box, I don't know how that will work. If the ban the box is going to apply to state level, Mr. Obenchain knows.
At least as I understand, what I want is for these crimes to have to be reported to the local school divisions. They need to know these things. And we're still working out some of the language. And I was just consulting with School Boards Association. I want to make sure that we accommodate their concerns and make sure that they have all the information they need in order to make the appropriate decisions necessary to protect the kids in the school system. We're going to do that.
Does that complete your question, Senator Cosgrove? Okay. So there's a motion from Senator Carrico that the bill be reported and re-referred to courts. All those in favor will record their votes aye. Opposed, no. Clerk, close the roll.
Yeas 15, nays 0.
15 to nothing. The bill is reported. Senator Carrico.
Senate Bill 456, Senator McClellan's bill dealing with school climate, not climate change, climate survey, requiring such survey and questions on the leadership and of the teachers, the autonomy and so forth on the evaluation teaching level. It was recommended to report with amendments if the staff could report the amendment.
Tom?
Thank you, Mr. Chairman. On line 5, introduced after school, strike climate, insert personnel. On line 24, introduced after develop and strike make available annually to, insert administered biannually to individuals holding a license from the department in. Line 24, introduced after school, strike teacher. Line 25, introduced after school, strike climate, insert personnel. Line 27, introduced after survey, strike shall, insert may. And then, I'm sorry, I don't have the bill in front of me, but at the end of the bill, a report from the two subdivisions. Give me 1 second.
I'm going to move those amendments.
Okay, Tom, you good?
Thank you, Mr. Chair. On line 36, the superintendent shall report the results of the surveys required by subdivisions 5 and 6 to the Senate Committees on Education and Health and Finance and the House Committees on Education and Appropriations.
Perfect. There's a motion and a second that the amendments be agreed to. All those in favor say aye. Those no, and the amendments are agreed to. Senator Carrico.
It was recommended that we report this on a 5-0 vote, and I so move.
Motion is second that the bill be reported. All those in favor record your votes aye. Those opposed no. Clerk will close the roll. 15-0. Senator Carrico.
Senate Bill 476, Senator Reeves' bill dealing with principals providing incident reports of criminal misdemeanors or status to law enforcement if at the principal's discretion. Passed this body last year, and it was recommended we report 5-0, and I'd so move.
Motion and a second that the bill be reported. That is 464. All those in favor record their votes aye. Those opposed no. And the clerk will close the roll. 15-0. The bill's reported. Senator Carrico.
Next is Senator Hanger's bill dealing with school bus operators training. It codifies the hourly requirements. There is a substitute to that, and I would move the substitute.
Sorry, sir. Motion second that substitute be agreed to. All those in favor will say aye.
Aye.
Opposed no, and substitute agreed.
Senator Hanger presented to the committee the changes in decrease in the 24 to 6, codifying what the current in several different places of those that have commercial licenses and those that don't. With the shortage of school bus drivers, I think it's something to try to address the ability to hire more drivers, and it was a recommendation of the committee to report the substitute on a 5-0 vote, and I'd so move.
Motion is second that the substitute to 557 be reported. All those in favor record their votes aye. Those opposed no. And the clerk will close the roll.
Yea, 15, nay, 0.
15-0 is reported. Senator Carrico.
Next, Senate Bill 658, Senator Wagner's bill, which is a pretty good concept that clarifies that school boards and school divisions can participate in a regional joint school applying for literary funds. And it was recommended that we report on a 5-0 vote, and I'd so move.
Motion and a second that Senate Bill 658 be reported. All those in favor record their votes aye. Those opposed no. And the clerk will close the roll.
Last was Senator
Yea, 15, nay, 0.
Sorry. Senator 15-0. The bill is reported. Senator Carrico.
Last was Senator Donovan's bill 713, standards of quality, the mathematics intervention services. The motion failed to report, so there's no recommendation on that. And Senator Donovan's here if you want to take the bill up.
Senator Donovan, you mind if I just hold that over to next week? We've got a time problem today. So with that, does that complete your report except for
Senator Marsden, who's here?
Senator Marsden, we like you, but we're not going to take your bill up today. There's too close on time, okay? So I apologize. You've been a good sport about this, but we're not going to do that. If you're okay, without objection, the bill will go by for the day. And also the same will be for Senate Bill, Mr. Chairman, is okay. Senate Bill 169 go by for the day. All right, with those, that completes your report, sir? Yes. All right. To the patrons, Mark, do you have people here today for your bill? The charter school bill?
No.
All right. Would you be terrible if we held, we're just going to push it hard today. We apologize to you. So, Senator Stewart, how about you, sir? Do you have people here to speak to your bill today?
Mr. Chairman, I'm not sure. Is there anybody here to speak to the school nurses bill?
Senator Stewart, would you mind if we?
How about the military education?
Okay. So, Stewart, you're okay if we just, with apologies, and Senator Eben, are you okay if we push your bill?
I've got got a witness, but,
Which one is that, sir?
that is.
Senator Stewart, thank you.
Senate Bill 605, easy bipartisan bill.
Yeah, we're not doing that today either. I'm sorry, sir. We can do this. We can maybe hear your testimony in a little bit, okay?
Yeah, witness, is that okay?
Yeah, but we're not gonna do it right now. We'll do it in just a minute. We've got, and I know both of the, Mark Obenchain, if you don't mind indicating that some of us are not gonna be there for caucus, and I understand the Democrats are not gonna be there for caucus as well. So with that, we're gonna go to the Health Professions Subcommittee. If you just wait, we'll get to you before we're done. Senator Suderline.
Thank you, Mr. Chairman. Senate Bill 25 from Senator Spruill, he requested that be struck, and
Without objection, Senate Bill 25 will be stricken. All those in favor would say aye. Okay, so it's stricken. So next up, Senator Suderline.
Senate Bill 226 from Senator Stanley, he had a substitute. I move the adoption of the substitute.
So motion is seconded. Substitute be agreed to. All those in favor will say aye. Those opposed, no. And the substitute's agreed to. Senator Suderline.
We recommended that substitute that's now before you report on a 6-0 vote.
There's a motion and a second that Senate Bill 226 be reported in the form of a substitute. All those in favor will record their votes aye. Those opposed, no. And the clerk will close the roll.
Yeas 15, nays 0.
15-0, Senator Suderline.
Thank you, Mr. Chairman. Senate Bill 464 came to us from Senator Reeves. Well-intentioned bill that, with discussions with the patron, he believes that it would be best if the bill was passed by indefinitely, but if you'd be willing to write a letter to the Board of Medicine expressing the concerns on the PMP reporting, and I would so move that.
All right, I will, and the motion is that the bill be PBI'd. All those in favor of PBI and the bill will record their votes aye. Those opposed, no. And the bill, clerk close the roll.
Yeas 15, nays 0.
15-0, the bill is PBI. Senator Suderline.
Thank you, Mr. Chairman. Senate Bill 544 from Senator Obenchain expands those that can participate in the prescription drug donation program. This had wide support, and we recommend report on a 6-0 vote.
There's a motion and a second that Senate Bill 544 be reported. All those in favor will record their votes aye. Those opposed, no. And the clerk will close the roll.
Yeas 15, nays 0.
It's 15-0. Those of you in the audience, the subcommittee has gone through this, had testimony. I know that I have read through all these bills. I think there's a good understanding, so you don't think we're moving through bills without great care. They have been dealt with before. So, Senator Suderline.
Thank you, Mr. Chairman. Senate Bill 632 from Senator Donovan. It eliminates a surgical exception on participating in the PMP. We all agreed on that as well on a 6-0 vote.
It's a motion and a second that the bill be reported. All those in favor will record your vote aye. Those opposed, no. And the clerk, David, will close the roll.
Yeas 15, nays 0.
15-0, the bill is reported. Senator Suderline.
Thank you, Mr. Chairman. And Senate Bill 635, with discussion with patron Senator Donovan, we recommend that be passed by indefinitely with a letter from you to the Director of the Department of Health Professions.
All right. Would the chair mind if we just struck that bill and then we'll still have the letter? Is that okay with you? All right, so without objection, Senate Bill 635 will be stricken from the calendar. Is that okay, Clerk, to do it that way? We need to record it. Okay. Without objection, it'll be stricken from the calendar, and there will be a letter sent in regards to the administration of that drug. Senator Suderline.
And Senate Bills 726 incorporate Senate Bill 795. So I would first move that we incorporate Senate Bill 795 into Senate Bill 726.
There's a motion and a second that Senate Bill 795 be incorporated into Senate Bill 726. All those in favor will say aye. Opposed, no. And the bills are incorporated. Senator Suderline on a substitute.
With that substitute before you, I would turn that over for the remainder of the report to Senator Donovan, who's the co-chair, and those are her bills as well.
All right, so we need a motion on the substitute. Move the substitute. Thank you. There's a motion and a second that the substitute to 726 be agreed to. All those in favor will say aye. Opposed, no. And the substitutes agreed to. Senator Donovan.
Yes, Mr. Chairman. This is, these bills were rolled together because one of them was a recommendation from the Joint Commission on Health Care. It's a discussion we've been having for a few sessions now, and this basically just takes the compounding process that we have put in place for CBD and THCA oil into the hands of the physicians to determine for what diagnoses or conditions they will recommend that use, as opposed to the legislature deciding piece by piece. The other amendments are simply to clean up dosing schedule to make it more safe and prescribing, all of which has been approved by the Board of Pharmacy.
So the motion is that we report as a substitute and re-refer to courts, right?
Yes, sir.
There's a motion and a second that the bill be reported and re-referred to courts. All those in favor record their votes aye. Those opposed, no. And the clerk will close the roll.
Yeas 13, nays 2.
13 to 2, the bill is reported and referred to courts. Senator Donovan.
Mr. Chairman, I don't have my report in front of me. What is the next bill that we're discussing?
Senator Sudeline.
Yes, Mr. Chairman, the next bill from Senator Donovan, Senate Bill 728, which we also recommend the report of a substitute, so I would move the substitute.
Motion is second that the substitute be reported. All those in favor say aye. Those no, and the substitute 728 is agreed to. Senator Donovan.
Thank you, Mr. Chairman. This is simply a means by which we can have a better conversation between legislators and the people who monitor the prescription monitoring program in hopes that we can continue to guide interventions that we have ongoing in the state to best identify over-prescribing of narcotics and opiates.
Okay. Is there a motion on the bill? There's a motion. It's substitute's been agreed to, so you're moving to substitute be reported. Is that right, sir? Yeah. So there's a motion and a second that Senate Bill 728 as a substitute be reported. All those in favor will record the vote to aye. Those opposed, no. And the bill is, clerk, close the roll. Sorry.
Yeas 15, nays 0.
15 to 0. The bill is reported. Senator Donovan.
Mr. Chairman, I believe the only
735.
735. Thank you, Mr. Chairman. 735 is an additional PMP intervention where we are just giving access to DMAS, to the medical directors at DMAS, so that they can track prescribing that's happening through the managed care organizations with whom they contract. The managed care organizations now have oversight. The key is that we have checks and balances. So we have a couple of sets of eyes, and Virginia knows how she's spending on opiates through her MCOs at the Medicaid program.
Okay. Are there any questions about this bill? Just slow down just a little bit. We feel good about it. Senator Cosgrove.
Thank you. Mr. Chairman, I'm all concerned about a lot of these opioid bills that we're doing right now. Basically, we are really tying the hands of physicians to a great extent on how they are prescribing pain medications. And I understand there's a tremendous opioid problem. But somebody that has knee surgery or hip replacement surgery, for them to have to keep going back every few days for their pain medications is becoming problematic. So I hope we're not overstepping or doing more, and certainly I'd defer to Senator Dunham, that being a medical doctor herself, but I've talked to numerous people that basically their doctor's saying, hey, I'd like to give you more, but I can only give you so much. I don't know what the answer is. I just think it needs to be out there and part of the discussion.
Well, Senator Cosgrove, you're right. This is a very sensitive subject, and you're going to hear about it one way or the other. I think the Donovan approach is important, but you're not wrong. It's an item that we need to consider. Senator Donovan, have you made a motion on your bill?
I have.
And Senator Lott, did you want to speak, sir? I'm sorry. No. Okay. There's a motion that the Senate Bill 735 be reported. All those in favor will record their votes aye. Those opposed, no. And that bill is reported. Thank you, Senators Sudeline and also Donovan. Senator Donovan.
I do not want to derail us, but if I can just follow up quickly as a physician and an advocate for physicians. The bills we're passing, Senator Cosgrove, do not obstruct prescribing beyond the 7-day window. It only requires that the physician check the PMP if indeed they do prescribe for more than 7 days.
Mr. Chairman.
Senator Cosgrove.
I understand that, but somebody needed to bring the issue forward because we really haven't discussed it. We have all of these bills dealing with opioid prescribed medicines, but I just wanted to put that out there as a discussion item.
Right. I tend to agree that, but thank you very much to that subcommittee. Next up, we are going to go through, with concurrence of both sides, we're going to go through the Health Subcommittee report. Those of you patrons, except for Senator Eben, I don't know if we're going to get to you or not. We're going to try to. We are going to do 511 at the end of that. Senator Cosgrove.
Thank you, Mr. Chairman. First bill is Senate Bill 225. It's Senator Stanley's bill. Basically, it is an opioid addiction treatment pilot. Basically, it requires the Department of Behavioral Health and Developmental Sciences. Well, first, let me move the substitute.
There's a motion is second. The substitute be agreed to. All those in favor will say aye. Opposed, no. Substitutes before us.
Thank you, Mr. Chairman. Senator Stanley made a compelling argument about opioid addiction in that part of the Commonwealth, basically stating that part of his district was the highest abuse level of any of these. So this would set up a treatment pilot program, and it was the recommendation of the subcommittee to report the substitute 5-0, and I so move.
Okay. There's a motion and a second that the substitute to Senate Bill 225 be reported. All those in favor record their votes aye. Those opposed, no. Clerk, close roll. It does. The clerk will strike the board. I apologize. So the motion, Senator Cosgrove, is that the bill be reported, and I know we got a late letter on it, be reported and re-referred to finance. And there's a second. Those in favor record your vote ayes. Those opposed, no. And the bill, Senator, will close the roll.
Yeas 15, nays 0.
Ayes 15-0. The bill's reported and referred to finance. Senator.
Thank you, Mr. Chairman. Senate Bill 310, Senator DeSteff's bill, basically deals with eligibility for services under waiver. It prohibits the Department of Medical Assistance Services from reducing, terminating, suspending, or denying services for an individual enrolled in a waiver. There was a lot of back and forth between DMAS and some of the recipients of these waivers, Mr. Chairman. We felt the bill had great merit. But there is a tremendous liability, according to DMAS, that may happen if the bill goes forward. However, the testimony was compelling, and so it was a recommendation of the committee to report the bill and then re-refer to finance where they have the resources to look it over. And Senator DeSteff is here if there are questions.
All right, Senator DeSteff, I think we're in good shape on this bill. I want to talk to you about another bill, but if we're good on that bill, Mr. Chairman, if you just make your motion, I think we're good on that bill.
I did, Mr. Chairman. I moved to report and re-refer to finance.
Thank you, sir. Motion is that the Senate Bill 310 will be reported and re-referred to finance. All those in favor record your vote ayes. Those opposed, no, and the clerk will close the roll.
Yeas 11, nays 3.
Senator Lucas. Yes. The clerk, can you strike that, or do we need to reconsider the vote? Okay. Without objection, the roll will be stricken. And Senator Cosgrove, if you make that motion once again, please.
Yes, sir. Senate Bill 310, the recommendation is to report and re-refer to finance, and that was a 4-0 to 1 abstention vote.
All right. All those in favor will record their votes aye. Those opposed, no. The clerk will close the roll.
Yeas 9, nays 6.
9-6, the bill is reported.
All right, thank you, Mr. Chairman. Senate Bill 329, Senator Dunavant's bill, provides that the prohibition on local clinics for treatment of persons with opioid addiction. Wait a minute. Do I have a substitute on that? Or is it? There is a substitute? All right, Mr. Chairman, I move the substitute.
There's a motion and a second that the substitute be agreed to. All those in favor will say aye. Opposed, no. Substitutes agreed to.
Thank you, Mr. Chairman. What the substitute does is it rolls Senator McClellan's bill 455 into Senator Dunavant's bill 329, and thereby basically provides that prohibition on locating clinics for treatment of persons with opioid addiction through the use of methadone or opioid replacements, other than opioid replacements approved by treatment of opioid addiction, the USDA, within 1/2 mile of a public or private licensed daycare center or public or private K-12 school.
Okay.
It was a recommendation of the committee to report 5-0, and I would so move.
So, did we incorporate everything in there, guys? You feel good about the incorporation? Okay. There's a, John, if you don't mind just having a motion that we roll 455 into
That was the substitute, Mr. Chairman.
Yeah, did it roll? They want us to have that as a separate vote, so if you don't mind, we'll just move that.
Mr. Chairman, I would move that we roll Senate Bill 455 into Senate Bill 329.
It's motion and second that we roll the two bills. All those in favor record your vote ayes. Those opposed, no. Clerk will close the roll. Oh, sorry. We good?
15-0.
15-0. Thank you, John. Would you go back and make your motion then?
Yes,
now?
sir. Having previously explained the bill, I move to report the bill. It came from the committee 5-0. So moved.
There's a motion and a second that the bill be reported. That is Senate Bill 329. All those in favor record your vote ayes. Those opposed, no. The clerk will close the roll.
Thank you, Mr. Chairman. Senate Bill 389 is from Senator Chafin. It provides the Department of Health shall serve as lead agency with responsibility for development, coordination, and implementation of a plan for services for substance-exposed infants in the Commonwealth. The plan supports trauma-informed approach to identification and treatment of substance-exposed infants and their caregivers, includes options for improving screening and identification of substance using pregnant women, uses multidisciplinary approaches to intervention of service delivery. There is an amendment, Mr. Chairman.
Okay. The clerk report the amendment.
Thank you, Mr. Chairman. Senator Cosgrove. On line 23, after services, insert the. On line 25, introduced after of health, insert the Virginia chapter of the American Academy of Pediatrics, the American Congress of Obstetricians and Gynecologists, Virginia section. And then this amendment wasn't heard by subcommittee, but the patron asked for it in between sub and full. Line 25, introduced after appropriate, insert the department shall report annually on December 1 to the General Assembly regarding implementation of the plan.
John, you okay with that? All right, John, you okay with the
Yes, that's fine,
amendments?
Mr. Chairman.
All right. There's a motion and a second that the amendments be
Mr.
agreed
Chairman.
to. Senator Donovan, yes, ma'am.
I just want to address, A, this has a fiscal impact, so it would have
It's
to go.
going to finance.
But
ultimately.
the second thing is that there's already a private organization that is supported by the Department of Health. We established it last year. It's the Neonatal Perinatal Collaborative. That is a group of clinicians that are on the front lines of dealing with this, that are looking at statewide best practices, that really encompasses this without spending additional money. It is an important issue. I'm just concerned about duplicated services and a conflict between bureaucracy and clinicians.
Good point. I think if it goes upstairs, I think it'll be in our HHR subcommittee.
Correct.
We probably get to an opportunity to merge those up. Senator Cosgrove.
Yes, Mr. Chairman, it was the recommendation to report with the amendment 5-0, but that motion would have to be to report and then re-refer to finance, where apparently everything has to go to get fixed.
So the
And we're told
motion
every
is
time.
that Senate Bill 389 be reported and re-referred to finance. All those in favor record their votes aye. Those opposed, no. And the clerk will close the roll. Senator Lott.
Yeas 14, nays 0.
Okay. Next up, Senator Cosgrove.
Thank you, Mr. Chairman. Senate Bill 399, Senator Lewis bill. There is an amendment to the bill, Mr. Chairman.
Clerk will report the amendment, line amendment, I think it is. It's the may to shall, right? Yes. All right, we'll get it in a second.
Mr. Chairman, there were several amendments. I think it'll end up being a substitute, but removing drug throughout the bill, the word drug throughout the bill, so there'll be local and regional overdose fatality review teams rather than drug overdose fatality review teams. And then on line 389, after examiner, strike shall, insert may. On line 390, after protocol, strike shall, insert may.
Yes, Mr. Chairman, I move the amendment.
Okay, there's a motion and a second that the amendment be agreed to. All those in favor will say aye.
Aye.
Those no, and the amendments are agreed to. Senator Cosgrove.
Thank you, Mr. Chairman. The bill becomes then, instead of instructory, it is optional for the localities. And basically, it takes out the word drug because there are other substances that can be abused and addictive. So with those amendments, Mr. Chairman, the report was to recommend reporting 5-0, and I'd so move.
Now that it's permissive, there's a motion that the bill, that be Senate Bill 399, be reported as amended. All those in favor will record the vote aye. Those opposed, no. And the clerk will close the roll.
Yeas 13, nays 2.
13-2, the bill's reported. Senator Cosgrove.
Thank you, Mr. Chairman. Senate Bill 417, Senator Barker's bill. There is a substitute on the bill, Mr. Chairman.
There's
I would
motion
move
is
the
second that the substitute be agreed to. All those in favor say aye.
Aye.
Those no, the substitute's agreed to. Senator Cosgrove.
Mr. Chairman, sorry, Senate Bill 417 requires the Department of Health to approve one or more entities to certify community health workers in the Commonwealth and prohibits a person from using or assuming the title of a community health worker unless he is certified by an entity approved by the department. It should be important to note that this is not a licensing procedure or something that has to go through DFOR. The recommendation was 5-0 to report, and I so move the substituted bill.
There's motion is second that Senate Bill 417 as substitute be reported. All those in favor record their votes aye. Those opposed no. Clerk close the roll.
Yeas 14, nays 0.
14-0. The bill's reported. Senator Cosgrove.
Thank you, Senator. The next bill, Senate Bill 670, Senator Deed's bill. Mr. Chairman, what this bill would do is require fire departments and emergency medical service agencies to develop curricula for mental health awareness training for their personnel. The bill provides that such personnel who receive the training shall receive appropriate continuing education credits. This is permissive. Basically, it does instruct that each locality or fire department would have to establish a curricula, but it is up to them how they do it. It is not mandatory that their personnel have to take it. That was the bill, Mr. Chairman. As we all know, firefighters and EMTs see some of the most terrifying and tragic accidents, and sometimes they are in need of that help. With that being said, the recommendation was to report the bill 5-0, and I so move.
Motion is second that Senate Bill 670 be reported. All those in favor record their votes aye. Those opposed no. Clerk close the roll.
Yeas 14, nays 1.
14-1. The bill's reported. Senator Cosgrove.
Thank you, Mr. Chairman. My final bill is Senate Bill 703, and there is an amendment.
Clerk report to amendment.
On beginning line 19, strike 5, insert 10.
There's motion is second that the amendment be agreed to. All those in favor say aye.
Aye.
Opposed no. The amendment's agreed to. Senator Cosgrove.
Thank you, Mr. Chairman. The bill authorizes an emergency medical services provider who holds a valid license or certification in the state that borders the Commonwealth to provide emergency medical services. In the Commonwealth, the such services are provided at a widely attended event open to the public and are due to the expected number of attendees. The anticipated need for emergency medical services at the event is beyond the capacity of the local emergency medical service providers. Mr. Chairman, this obviously happens on areas that may have a large attended event, a concert, some type of festival, where the local EMT and fire departments are not able to handle a very large-scale event. So it was a recommendation of the committee to report the amended bill 5-0, and I so move.
Motion is second that Senate Bill 703 be reported with amendment. All those in favor record their vote ayes. Those opposed no. The bill and clerk close the roll.
That completes my report, Mr. Chairman.
Yeas 15, nays 0.
15-0 is reported. Can I have a motion to reconsider Senate Bill 670?
Having voted on the prevailing side where we passed 670, I asked that we reconsider that.
Those that will reconsider the vote will record their vote aye. Those opposed no. The clerk will close the roll.
Yeas 15, nays 0.
15-0. Would you have another motion, sir, to report?
Yes,
the bill?
sir. I move that we report Senate Bill 670.
Motion is Senate Bill 670 will be reported. All those in favor record their votes aye. Those opposed no. Senate's ready to vote. Clerk will close the roll.
Yeas 10, nays 5.
10-5. The bill is reported. Sir, does that complete your?
Yes, sir, it does.
Great. Would the committee consider, Evan, we're almost there, right? But Senate Bill 511, are we prepared to go, David? All right. Is there a substitute that's printed out, Tom? This is the ophthalmology bill.
Yes, sir.
If so, could we distribute the amendment? David, could you explain what the amendment in the nature of substitute does?
Thank you. First, I'd move the substitute.
This motion is second that substitute be agreed to. All those in favor say aye. Aye. Opposed no, and substitute's agreed to. David?
Thank you, Mr. Chairman. Explained the concept earlier. I'd direct your attention to lines 25. makes it clear there that the practice of optometry does not include surgery, just as we have in the previous ones, but that it will allow the use of injections. The purpose of this is for operations on the eyelid. And then, as you see further down on lines 39 and 40, it specifically clarifies that the limited use of injections when they are allowed, and that the code section that's cited there, 54.1-3222, that then begins in line 49, and you can see where it continues all the way down in line 76. It again makes it clear for the eyelid treatment that's allowed to include Schedule 6 controlled substances.
Okay.
It also continues there that says the training for these injections is authorized if they have, if the optometrist that would be using it has didactic and clinical education on this, or that they'd previously graduated from a school on the subject that included that. And I mentioned that this is something that has been being taught in the schools, as was the other procedures, but there was more heartburn on that since the early 1990s. You can also see, to make sure that those courses are satisfactory, that the board will certify that those courses have been completed and that they are acceptable in the way that we do on other education requirements for professions.
Great, David, that's a great explanation. John, Cal, you guys have some comments you want to make?
Mr. Chairman, members of the committee, again, John Garrett Kemper on behalf of the Virginia Eye Surgeons and Physicians and Surgeons. Not much to add. It's pretty self-explanatory like we had before. It eliminates surgery, allows injections of Schedule 6 drugs to treat chalasia only. It's a reasonable clinically based compromise. Thank you.
Okay, Mr. Keeney, you good?
Good.
Good. Medical side, good. All right, the substitute is before us.
Mr. Chairman. Mr. Chairman.
Yeah, Senator Cosgrove.
Thank you. Mr. Chairman, I'm going to vote against the bill, against the substitute, not meaning any malice to the bill, but I really want to talk to my optometrist, okay? And with all due respect to everybody that's here, I'm sure it's going to be fine, but don't take any bad feelings on my votes.
Great.
Okay? Just
Okay.
want to say that.
I hope the rest of you will pass it so I have an opportunity to explain this on the floor then.
Perfect. All right, there is a motion and second that Senate Bill 511 in the form of a substitute be reported. All those in favor record your votes aye. Those opposed, no. And
Please
the clerk
score me an aye. It's not
will
showing up here.
close the roll.
Thank you.
All right. 14-1, the bill is reported as substitute. To everyone that worked a long time, I know that I was working on it at 5:30 this morning. As a result, I have one pair of pants from one suit and a jacket from another suit on this morning. They are fortunately both gray, but all right, Mr. Eben, would you like to go, sir?
Yes. And I'll preface it by saying that when I was in the House, I once wore a tuxedo jacket with gray pants, and it was quite embarrassing. So this is SB 605. I'm going to really briefly explain the bill and a piece of the substitute, and I'm going to have our witness, Dr. Cheryl Shakeshaft, who's an expert in this topic. Under the federal Every Student Succeeds Act, there's a requirement that states prohibit administrators and other school employees from aiding and abetting employees in obtaining a new job if there's probable cause or proof that the employee engaged in abuse, that the person recommending them knew about this. And the substitute that you'll receive at your next meeting, I guess, says that they would also be prohibited from hiring them if they knew about it. And you can hear about a case in Loudoun County next week. And this includes public and private schools. But Dr. Shakeshaft is a professor of education leadership, VCU, and has authored a study on sexual misconduct, and she's reviewed more than 1,000 cases of this type and helped pass a similar law in Nevada. So why don't you just...
Hi,
Welcome.
I'm
Thank you.
Cheryl Shakeshaft. I'm Professor of Educational Leadership at VCU. I study adults who sexually abuse students in K through 12 and higher education. My work was used to develop the federal Education for All Students Act, as well as by legislators in Nevada, Colorado, Washington, Missouri, Oregon, and a number of other states. I'm author of a U.S. congressionally mandated study of the prevalence, causes, and harm caused by employee sexual misconduct in schools. And we found that up to 10% of students are the target of employee sexual misconduct. That's 4.5 million students in this country. These are only the students in public schools. There are others who are in independent and private schools. Teachers and coaches are the largest proportion of these offenders. I studied more than 1,000 cases of employee sexual misconduct in schools and found that it is quite common for school districts to pass the trash, meaning they agree to let an employee resign and move to another school district without saying anything. When the school district calls the former district to ask for a reference, the sexual misconduct is not mentioned. For instance, it's often the case, they'll say, was this person a good band director? And they'll say, yes, they're a great band director. And then when I interview them, I say, why didn't you say anything about the sexual misconduct? And they say, they didn't ask me. They only asked me if he was a good band director. And so the threshold for a criminal conviction is quite different and much higher than the standards required of a school employee. Therefore, I strongly urge that or support that the sending school district not only can not recommend, but also that they, if they have any reason to believe that sexual misconduct has occurred, that they cannot hire.
Well, we appreciate you coming. This bill clearly has got a lot of merits. It's just getting into the details between us and courts, but we are grateful that you came today and shared your testimony with us. We're going to take it up another day, but we'll remember your testimony. Senator Edgerton, thank you for the testimony
Thanks,
today.
to the members of the committee for your indulgence.
Without objection, the bill will go by for the day. Next up, Senator Mason, we're not going to quite get to your bill today. If you don't mind, we're going to kind of bye for the day on that one. Wish you well next time. Senator DeStefis, hear yours real quickly. I think there's an agreement with Senator McClellan that she helped us work on, and we'll take that one up, and then Senator Black, and then maybe we'll be pretty close to being done for the day.
Okay, well, thank you, Mr. Chairman. We have a substitute, but I want to make sure I see the substitute because I'm not sure if it has education on line 12, I'm sorry, elementary on line 12 pulled out or not.
It does not.
It does not.
We'll amend it in just a second. Is there a motion and second on the substitute, and we'll amend the substitute? Motion and second that the substitute be agreed to. All those in favor say aye. Opposed, no. And then the substitutes agreed to. Senator, explain why you want on line 12 to remove elementary.
Because this problem isn't just in elementary schools, it's elementary, middle, and high schools.
Right.
And the catalyst behind this was high school students that came to me as
Right.
well as high school middle.
There's a motion and second that we remove on line 12 the word elementary. Is there a second? All in favor, recorded, will say aye. Opposed, no, and elementary is removed. Senator, tell us what substitute does very quickly, and we'll be ready to go.
Mr. Chairman, members of the committee, thank you for having me today. What this does is, on our forms of Virginia Beach and other localities, it has in here under students' race, American Indian or Alaskan Native, Asian, Black or African American, Native Hawaiian or other Pacific Islander, or white. I had a group of children come to me and school board members saying, you know, who am I going to offend? One of the young ladies who was, her mom was Lebanese, her dad was American and white, said, you know, I'm not African American, I'm not Black, and I'm not white. What do I choose? Because am I going to offend mom or dad?
Got it.
And on this, you can choose multiple, but you can't choose if you're Malay or if you're Middle Eastern or if you're MENA. There's a lot of groups that are, you know, you're having a child decide or a parent decide when we're asking in the legislation on all schools to put other so they can select other if any of the ones don't apply here. I did work with Senator McClellan on this just to get the language right, and Tom, thank you for last night as well helping us with this. I think this solves a problem. I'm hoping it handles everything on this. And, you know, I thank everybody who brought it to my attention and then assisted with me on this.
Great. So the substitute, I know some of you saw this bill and read it before. It would probably eliminated an ability to get any information and really kind of undone our longitudinal data. And this bill inserts the word other. Anyone out there in opposition to the bill? Okay. The bill's before us. There's motion and second that the bill as amended be reported. All those in favor record your vote aye. Those opposed, no. And the bill is, close the roll.
Yeas 12, nays 3.
Mr. Chair, members of the committee, thank you very much.
12-3, the bill is reported. Senator Black, quick, let's get your bill because we need to get it up to courts. So,
Thank you, Mr. Chairman. This bill came in at the request of the Loudoun County School Board. We've got a very rapidly growing county, and it deals with facilitating the establishment of schools. What it does, it says that whenever the school board or governing body acquires real property to construct a school, that body will not be subjected to unrecorded covenants or equitable servitudes unless the body had actual notice of such. Usually that's because it's recorded in the clerk's office. But if they had other actual notice, then it would still apply. And so I
all right,
ask
Senator
that
Black,
you.
is there anyone here in opposition to the bill? I know it got a little concern about it during the week, but hopefully it's in good shape to at least
Mr.
go to
Chair.
the courts. Senator Peterson.
And I already gave away my bill, so I can't look at it, but does this have to do with mechanics liens?
No, it has nothing to do with mechanics. It's basically just, it deals with just unrecorded covenants and equitable servitudes on land unless they are recorded or there's actual notice.
Senator Peterson.
I was going to say, if they're not recorded, they're probably not much good anyway. Last time I checked, I mean, if something's not recorded, it's not effective.
Well, and generally that's the case. We had one court case that went the other way, and so you're correct. Generally, you got to record it if you want to preserve it, but this basically clears the way so that the schools can be built without any litigation hazards.
Senator Peterson, does that complete your question? All right, there's a motion and a second that the bill be reported, but re-referred to courts. All in favor, record your vote aye. Those opposed, no.
And my vote's aye.
Yes, sir.
Thank you.
And the clerk will close the roll.
Yeas 15, nays
15 to 0, the bill is reported and referred to finance. Guys, I think we're going to stop there. Just to let you know, I think we've covered about 50 bills today. We did yesterday have still 140 bills despite all the work we did last time. So this 8 o'clock thing might continue to work, or it might become a 7 o'clock thing, but we're going to try to work our way through that. Senator Peake, oh yeah, would you mind staying around? I know we had some people here for Senator Peake's bill, so let's do that real quickly. If you have to proxy out, it's okay, but I know you've had people that traveled, so I apologize. Senator Peake, you've got the bill that basically, if I'm not mistaken, keeps the training centers open. We're going to send it to Finance in case this committee is in favor of it. But why don't we hear from you?
Yes, it's Senate Bill 835, very simple, one sentence, that we shall keep the Central Virginia Training Center open, or it says it shall not be closed. And I have several people who have traveled from Amherst who have family members, currently have family members at the training center, or who have had family members at the training center in the past. All of you who support this bill, could you come up? I know it's going to have to be reported to Finance, but as this committee is well aware, and the chairman, you've done so much work for Central Virginia Training Center and these folks. We want to keep it open. It's not mandated to close till 2020. There's still a large number of residents who need to remain at that facility where they can get the care they need and deserve. And these folks have patients they want to keep there, and they want to keep it open.
Well, Mark, thank you. We're delighted to have you guys here. If you don't mind, I'm going to have to do it a little quickly, but we'll get a full hearing upstairs in HHR. Senator Donovan, Senator Howell, and I will be up there too, so welcome.
I want to thank at least two members on this committee who are co-patrons of this bill. So I have to correct Senator Peake on one thing very quickly. No training center is mandated to close. None. The DOJ settlement does not require that any training center close. And ICF ID placement, which is what a CBTC is a federal entitlement. So closing this and putting people out who are opposed to going actually breaks the law. Of 208 people who have been discharged from CBTC since 2011, 29 have died. That's a 14 to 15% higher death rate from CBTC than from any other training center. CBTC has a very fragile medically complex group of people, and there are as many medically complex people at CBTC as at the other two remaining training centers combined. Several people were discharged from the training center against the wishes of their families earlier this year, and they died, some of them. One of them has had a urinary tract infection the entire year since she was discharged. It's just a mess there. 87 Lynchburg area physicians signed a physician's petition that was circulated by a local doctor to keep CBTC open. And there were some very compelling comments with that. One very compelling comment is there in the handout that I gave you. This was written by a doctor who said he had firsthand knowledge of the failure of deinstitutionalization of these people. So please support that bill.
Well, thank you for you have been an advocate for decades, so thank you very much. Martha, welcome. Delighted to have you here. Good to see you again.
Hi, I'm the mother of Taylor and Tyler Bryant, and the twins were forced out of the training center. Unfortunately, Tyler was dead within less than 2 months, 49 days in the hospital. So it's like being pushed off a cliff and the care destroyed. And Taylor continues to be at Hiram Davis, which is not a training center. I think CVTC should stay open. We need a west of Richmond solution. Thank you very much.
Martha, thank you for everything. We're sorry about the loss. What a tragedy. We're sorry about that. Sheriff, welcome.
Mr. Chairman, committee, I'm going to be very brief. I'm the brother of one of the few remaining residents at Central Virginia Training Center, and quite simply, we have nowhere else to go. My mother's here with me. We last 2 weeks ago had a discharge meeting with the staff there, and at the end, they conceded there is no place in the community that can handle or meet my sister's needs. She's been at the training center for 47 years, where she's been cared for and been safe with family involvement and staff involvement. So we just appreciate your support. Thank you, Chairman.
Grateful you came. Thank you very much. Anyone else?
That is all the mother, Sheriff Milner, and his mother. They have her daughter, his sister there. I'd ask that the committee pass this bill and send it to finance.
Are there those that are here to speak in opposition to the bill?
Okay, I'm sorry.
You want to come forward if you're in opposition to the bill. Welcome.
Good afternoon, Mr. Chair. Well, it's almost afternoon, members of the committee. Heidi Lawyer again with the Virginia Board for People with Disabilities. Great respect for the patron of this bill, as well as all of the family members who have loved ones at CVTC or any of the other training centers. The board supports continuing the current strategy by the Commonwealth to achieve the goals of the Department of Justice settlement agreement, which includes closing 2 of the 3 remaining training centers and continuing its strong efforts over the last several years to develop community capacity for individuals with even the most significant medical disabilities. I thank you for your time.
We're very grateful you came. Thank you. Yes, ma'am.
Mr. Chairman, members of the committee, Ashley Wright representing the ARC of Virginia. Hopefully you all received a letter from our Executive Director, Tanya Milling. She was not able to be here today. We do have concerns and would ask you to oppose this. With all due respect, there are a lot of financial considerations, as you're well aware, that we believe, with 12,000 people on the waiver waiting list right now, that perhaps the funds should be used elsewhere. Thank you.
Great. We're grateful for your testimony. Thank you. Yes, ma'am.
Hi, Chairman, members of the committee. It's Jenny Halborn again on behalf of the Disability Law Center. And for the reasons already stated, we are in opposition of the bill.
Thank you for coming.
Thank you.
Yes, sir. Welcome.
Good afternoon, Hank Foley. My son has severe medical condition that will require lifelong care. However, my wife and I seek to have that completed in the community. We believe that's going to be the best thing for him and probably the best thing for the 12,000 people or so who are on the waiver list. So please, I would urge you that that money is going to be best used putting the services into the community, and those people can be supported there. Of course, it's regrettable, any death at any time, but I warn you about the statistics. We know what Mark Twain said about those.
Okay. Thank you all for coming on both sides. Senator Black.
Mr. Chairman, I fought this battle for years and predicted the tremendous rate of death that has occurred almost immediately. And I think it's a great bill. I appreciate you putting it in, and I move to report.
Second.
Senator, speak. Anyone else
I'd
to
like to
speak?
speak.
Senator Cosgrove.
Thank you. Mr. Chairman, the Southeastern Training Center, while not in my district, is immediately adjacent to my district. I have visited there frequently. One of my constituents has an adopted daughter there. This is by far the best place for this young lady to be. The idea that everybody should be sent out of the community is just plain ridiculous. And I will say that basically when people talk about, well, we need to spend the money where we need it, I'm sorry, but that's where it's needed. Now, the whole idea of the rest going out of the community, and some of that's pretty self-serving as far as I'm concerned. So, Senator Peake, I admire you for bringing this forward. We have the same issue in Hampton Roads in the city of Chesapeake. These centers provide a critical living environment for people who would not survive elsewhere. Thank you.
Thank you, Senator Cosgrove. Senator Sudaline.
Thank you, Mr. Chair. Also, thank you, Senator Peake, for bringing forward this legislation. I have a lot of constituents who have family members who have received care at Southwest Virginia Training Center and also Central Virginia. I'm a lot more familiar with Southwest Virginia Training Center because it's in my district, and I've seen the great care people have received there from people that are well-trained and give them all the services they need. I know the previous speaker, I don't think meant the ill will that was said, but when you say that the thing about statistics, these are real people that we know in our communities in Southwest Virginia, that their brothers, their sisters, their daughters, their sons who have passed away when they no longer received the great level of care that they require through no fault of their own. And it's perfectly legitimate that we would use taxpayer funds for this care for these people who, through no fault of their own, need this high level of service. And I thank you so much for this, and I wish you all the best in finance.
Thank you, Senator Sudaline. Senator Howe, did you have?
Thank you, Mr. Chairman. I've been opposed to closing the training centers from the beginning. It's too late for the Northern Virginia Training Center, the one that specifically serviced my region. But it's not too late for other ones. I think that Central Virginia serves an unusual purpose in that it has the sickest of the sick, the most frail of all other frail people. And I can't, in good conscience, support closing it. And I think one of the great tragedies of this is it's pitting disability groups against each other. And I think what we really need is to all be working together to get the resources for all the people that need it.
Thanks, Senator Howe. Senator Black.
Move to report and refer to finance.
Second. Motion is second that the bill be reported and re-referred to finance. All those in favor record your vote ayes. Those opposed, no. Clerk, close the roll. Ayes 14, no 0. Senator Peake, thank you very much. We'll see you upstairs. With that, the committee will rise. Thank you all.